you want the mics off or on? Good evening and welcome to January 7th, 2026 Select Board meeting of the Town of Ashland. Nice to see a lot of people here this evening. Nice to have you. Happy New Year to you all. Hope it be a healthy and safe one. Before we do anything, I'd like to recognize an individual who said, yeah, you didn't think I was going to, right? You knew I was going to. Though he did it very quickly and very quietly without any fanfare, there's still going to be a little doo-doo-doo. Keep you cash. I would like to recognize retired police chief of Wayland, Ed Berman. Eddie, congratulations on a wonderful career, my friend. You did a great job. You did a great job in Ashland, and I'm sure Wayland was just as surprised as I was when I read that article.
You know, I just want to add to that, Joe, because I really, you know, a lot of people don't know, Ed, all the work that you did during COVID.
Oh, yeah.
And, you know, almost single-handedly, you kept schools open on days. I know that I talked to you a lot of mornings very early when you would meet teachers in to be tested so they could go to school, you know, obviously when they tested negative. I'm not sure other communities had that kind of work going on behind the scenes to keep schools open and people safe. And I know I certainly appreciated it, and thank you for that.
Now I have to read something else. And I drove the buses. And you drive the buses too, that's right.
And then there was that.
And then there was that. And then we would see him at the hospital if, God forbid, anything happened, and he would take care of us there as well.
In one day, you would see him in a lot of places.
In a lot of places, that's right. This meeting has already been opened, but I still have to read that the meeting is being recorded and broadcast live by WACA-TV and live streamed on Facebook. Remote participation is available using the Zoom video conferencing platform. Any disruption with this video conferencing platform will result in the platform being shut down. In that event of any disruption, broadcasting will continue on WACA-TV and live streamed on Facebook. The folks that are watching on live streamed, when the time comes, you have any questions, please use the raised hand icon, and we'll be happy to call on you when the time comes. We are running a little late, and again, I apologize. The first thing on our agenda is citizens' participation. If there's anybody here for citizens' participation, I ask that you come up to the podium, state your name and the reasons why you need to speak to us. Anybody out in the audience? I don't see anybody hand raised, so nope. Unless you see something I don't. Okay, then we will skip right over to our scheduled meeting, which is at 7:10. And I'd ask Rajit, the Public Health Director, and Dr. Zachary discuss the nicotine-free generation proposal, which is jointly with the Board of Health. And there are a number of individuals that are here to speak on its behalf. So if you would be so kind, thank you. Just make sure you can.
They need to open the Board of Health.
Oh, that's right, Board of Health meeting. You guys need to open up because you already did. Okay, cool. All right, thank you. So if you would like to, if you're already opened up your meeting, you're good to go. Thank you.
Okay. All right. Just making sure everything looks good there. Well, thank you very much for having me tonight. My name is Zachary Rich. I'm a lung and critical care physician. I make my living and pay my mortgage by treating tobacco-related diseases. And I'm very excited to come here tonight and talk to you about nicotine-free generation policies. I have a very brief overview that I wanted to share with you, but I also wanted to leave plenty of time to answer any questions. I also have Professor Kate Silbaugh here in the audience as well that can best address any legal concerns or any other issues that you might have as well. So I wanted to go over what is nicotine-free generation policies. So these are policies that change how commercial suppliers can sell nicotine and tobacco products. Currently, we use an age-based policy where as soon as you turn 21, you can go to a retail store and purchase nicotine and tobacco products. These plans would change it to a date-based, where in effect that means that anyone that can currently purchase nicotine and tobacco products will forever be able to purchase nicotine and tobacco products. But those that are unable to purchase nicotine and tobacco products will not be able to purchase those products even after they turn 21 if they are in that municipality. The goal of this is to have a gradual way of phasing out what remains to be the leading cause of preventable death and disability. I think it's very important also to say what these policies are not. These are not policies that criminalize the use of tobacco. These are not policies that criminalize the purchase of tobacco or nicotine products. These are solely policies that regulate retailers and their sale of these products. Nicotine-free generation policies have roots across the globe, from the Philippines to being considered in the United Kingdom, and we are very proud and fortunate to live in Massachusetts, which was where Brookline became the first in the country to implement these policies, even though they are being considered across the globe. So again, I think it's worth highlighting why these policies are so important, why I'm here in the middle of the night to invite you to consider these policies and do more for the children of Ashland than I can ever do as a lung and critical care physician. These policies give time for retailers to adapt to these policies, and they continue the progress of eliminating the most preventable cause of death and disability, which is nicotine use disorder and tobacco smoke. Many people have concerns about personal freedom and these policies, and I just wanted to touch briefly on those. These are realistic concerns that warrant discussion. When I see a patient who's addicted to nicotine, though, I see these personal freedom argument a little bit differently. For many of my patients, they tell me they have been smoking since they were a teenager, that they have tried their entire lives to quit. They have spent thousands of dollars. They have spent years of their life trying to quit this. And frankly, they're embarrassed. This is one of their biggest regrets. And universally, they tell me, I wish I had never started. This was a bad decision that they were coerced into by companies trying to gain them as customers when they were very vulnerable as a teenager. What I've never heard someone say is, I wish I could buy leaded gasoline. I wish I could buy asbestos. There's clear precedent of when governments have acted in the interest of public health, and I believe that nicotine-free generation is a great example of that as well. I also think it's worth highlighting a couple things about nicotine use. Really, nicotine use disorder should be thought of as a pediatric disease, and that's because the vast majority of people who start smoking started when they were an adolescent. 90% of adults that smoke started by age 18, 98% started by age 26. These are not people that say, I turned 40 and now I want to smoke cigarettes. No, these are unfortunately people that are still having their brain develop that are becoming addicted to this deadly product. So the best law is one that so shapes social norms that it becomes self-enforcing. I really like this quote because I'm not naive to think that if we pass nicotine-free generation, kids aren't going to smoke. I get that. Kids are going to find ways around these policies. But what we can do is change the conversation of this and say, oh, smoking, these are things that the previous generation did and paid for, and newer generations should be insulated from. So just to catch up on where things stand currently, as I mentioned before, these policy was first passed in Brookline, Massachusetts in 2020. This was challenged in the courts and was upheld in 2024 by the Massachusetts Supreme Court unanimously. Since then, many other towns have also adopted these policies. We are very fortunate to have the work of the Public Health Advocacy Institute that has volunteered their services for any future legal challenges that may arise. So since Brookline passed it, there's been many other towns that have passed it. Currently, we're up to 21 municipalities that have passed nicotine-free generation in Massachusetts. And this number continues to grow weekly. I apologize that the map here is out of date, but the number is now up to 21, as Leverett and Amherst have recently passed it and adopted it as well. This is a bipartisan issue. We've seen support for this in Massachusetts and in Hawaii, but also perhaps also equally important in conservative-leaning places as well. And I think that's not surprising because the answer of what age would you want your kid to smoke has a universal answer. These are policies that are common sense policies that are widely supported. Much of this work has followed off of Tobacco 21 work, which raised the age of smoking from 18 to 21. And many of these towns that initially passed 21 have now followed in passing nicotine-free generation. And I would invite Ashland, that was also a leader in passing Tobacco 21 legislation, to join this in passing nicotine-free generation legislation as well. Perhaps what I have found the most helpful is having people that these policies would actually affect come and discuss. We have had multiple high school students that say, I'm so sick of my friends being addicted to vaping. I'm so sick of not being able to go to the bathroom because it stinks of vape and other things. And so I would encourage you to consider having a public hearing where perhaps Ashland high school students would come and discuss their support for this as well. So we'd again, with our partner at the Public Health Advocacy, we have be happy to help with any crafting of the language or legal issues. But again, I wanted to save time for myself or Professor Silba or anyone else to ask any questions and see if there's anything we can do to answer that. Thank you very much for your time. Again, I'd be happy to answer any and other questions.
Thank you very much, Doctor. I'll open it up to the board. For any questions or comments, concerns at this time? Go ahead.
Want me to start? Okay. First of all, thank you very much for the presentation, and thank you both for being here tonight. And our Board of Health, thank you for joining us. So I have a couple things. One, you really kind of talk about it being like the children of Ashland, but the children are not, like, we have a 21, an age restriction up to 21 before they can even purchase any sort of tobacco products. So what this really is saying that legal adults, as they become 21 and older, would never be able to purchase in our town. So I feel like I'm completely against smoking, against vaping, against tobacco use. I've never been a tobacco user. I think it's a horrible, horrible thing, but that's my personal choice. I do feel like telling legal adults that they can't do something that's legal in the state is it's a slippery slope for me. I don't feel like, I feel like that it's different when you talk about raising the age of tobacco use versus not allowing it. I just feel like it's a disadvantage to our retailers. It's a disadvantage to our businesses, and it's not going to dissuade people from using tobacco products. It's just not going to allow them to purchase it in our community. So I feel that, I just feel like it's a bit of an overreach for a town to ban something that's legal. I would rather wait. I think it's more effective if the state takes action, and if the state mandates it top down. I think it has. I mean, I think it's a great concept. Like, let's phase out tobacco use. I just don't think that the implementation, town by town, of not allowing legal adults a choice to do something that's legal is I have kind of some issues with that.
Could I take a minute to respond to that?
Yep. Sorry if I was kind of
No,
all over the place.
I very much appreciate what you say. I just wanted to make sure I hit a couple of points. So first, the point of, oh, this isn't affecting the children of Ashland. I wanted to address that. So people who are under 21 primarily get their cigarettes and vapes from friends, siblings, others that are 21 or over. They're not getting it from 40-year-olds, 50-year-olds, 60-year-olds. So I do respectfully disagree and think that if you made it more difficult for adolescents and young adults to purchase these products, that would impact the children of Ashland. That by limiting an older brother, a cousin, or whatever, a friend from purchasing these, that will affect the children of Ashland, the teenagers that we can all agree we'd want to protect from these products. The second point I wanted to make sure I responded to, yes, in an ideal world, we would not have to be having this conversation. But I would invite you to consider the cost of not acting. At some point, it becomes that the public health benefit of making this change is too great to not make it. As we've said with leaded gasoline, with asbestos, and as Ashland said earlier with the Tobacco 21 movement, the Ashland passed the Tobacco 21 movement and said, yep, we know the rest of the state, the rest of the country says, yep, as soon as you turn 18, all right, you're an adult now, and you can purchase it. And the Tobacco 21 movement was very popular. It was supported by both at the municipal level, such as at Ashland, was signed at the state level, and eventually signed in by President Trump nationwide. So I would say that following that model, I don't think it's be best for Ashland to take a wait-and-see approach, because if that had happened with the Tobacco 21, then we wouldn't be where we are today.
Thank you.
Yes, thank you very much. I appreciate hearing your comments. You know, we do live in very challenging times, and I think a lot of us feel that our personal freedoms are at risk every day. However, you know, you struck a note with me, well, several places, but one being children in our schools. And, you know, I have a couple of grandchildren in schools, one in the middle school and one in the high school. And, you know, both have complained about the smoking in the bathrooms and having to experience that. And, you know, they are vehemently, they're very upset about it. They're vehemently opposed to smoking. Indeed, my granddaughter, too, has expressed how she feels for her friends who are in the position of smoking and vaping. And it's troubling that she even has to worry about her friends like that, right? You know, I'm curious about a couple of things. I wonder if, in terms of impact to businesses, I understand that because of the way it would be implemented, there is the ability for businesses to adjust. But do we have any information in terms of what the impact has been in businesses in these other communities?
So we probably know the most from looking at Brookline, where it has been implemented the longest. And in Brookline, there has not been a single retailer that has shut down since the implementation of these policies. Again, the reason I think it really is a genius policy is it gives that time to adapt. The only sales that would be prohibited next year are those for people turning 21. It'd be a fraction of the sales. But I do not have hard numbers to provide you because we don't have access to sales data from retailers.
Right. Do you know how, in terms of the state legislation, how fast it looks like the legislature might move? I don't feel like they tend to be leaders sometimes.
Yeah, I'm gonna preface it by saying I'm not an expert in this area. I'm passionate about children's health and lung health, but I truly do think that this is going to need something similar to the Tobacco 21 policies, where enough towns take their own initiative and pass it in Massachusetts before there's enough momentum to pass it at the state level. But again, that would be my own, just a personal opinion on that.
It would be interesting to have some input from, I think, other community members or from students, like you said. It would be interesting to hear from them. I too have seen what cigarette smoking can do, and not just for breathing, but for, you know, we've come to understand how many different bodily systems it impacts, and have seen it, you know, really result in people dying at very young ages as a result.
Yeah, and one thing that has really shocked me is for my younger patients in their 20s that are vaping, is how much stronger their dependency and addiction from vaping is compared to other of my patients that smoke combustible cigarettes. That these unfortunately very young patients are becoming extremely addicted from these products, more so than their elder counterparts.
Yeah, and just one final point, I appreciate too your, in your presentation when you talked about seatbelts and other things that, because it is, you know, overreach is an issue, and I think that it's a concern, but sometimes I guess the overreach is offset by other factors. Thank you.
Thank you.
Hello, thank you so much for your presentation. I really appreciate it. Just listening to what my colleagues have said, I want to echo some of their sentiments and just sort of add a question or concern of my own. So, you know, I think that it's an interesting proposal, but I do believe the net effect is basically to, make it impossible for people who are of legal age to make a choice to whether they want to smoke or not. I'm no fan of tobacco use. I've heard about terrible stories about young people, specifically with vaping, getting very sick and losing pulmonary function at terrible rates. And now we got this Zyn patch thing going on, which, the oral cancer rates are probably going to start spiking because of that. But I guess my concern is in the implementation, right? So, we can take a look at Brookline and talk about, well, let me bring it back a little bit. So, like in a town like Ashland, if we say, okay, we'll pass this and nobody before a certain birthday, if the surrounding towns don't pass similar legislation, people will be going immediately to other towns. We're more of a car-based culture here. It's a lot easier to hop those lines. I think even a regional strategy, even before a statewide strategy, if that doesn't look like it's going to happen, would seem to make more sense. I would also argue, or rather ask, about those retailers in Brookline. I think that's economically, that's sort of a very different kind of retail base than we see here in Ashland, with the size of business owners. A lot of folks aren't, they're not they're national chains here. They're, like mom and pops and stuff like that. So I would be concerned about those impacts as well. But like I said, in order for a policy for this to be effective, I would think it would have to be more regional in nature.
Thank you very much for those comments. Just two things I wanted to maybe highlight as well. I completely understand the concern of, well, if we pass it, then we're just losing these sales to the next town over, unless the next town over has also passed it. And Hopkinton has passed it, and there are starting to be other towns in the areas.
Are there, I'm sorry to interrupt, are there, for our surrounding towns, specifically Holliston, Framingham, Southborough, Westborough, do we know if these towns are actively addressing this issue right now or looking to get this legislation passed, or is there no effort in our surrounding towns at this point? Like, do you know what the status of that?
Yeah, and perhaps Professor Silbaugh could answer that even better. But we've had very similar conversations with those towns as we're having here tonight.
Okay.
So I would not say it's fair to say there hasn't been anything. We are. You very well point out that many towns take a wait and see to see what their neighbors do. But I did want to say that we do have some evidence when we looked at the effect of Tobacco 21 to say, oh, if we pass Tobacco 21, aren't those 19, 20-year-olds just going to go to the next town over? And a research paper, I'd be happy to share it, by Dr. Winikoff, did show that those effects, even when passed in isolation, had an effect at reducing adolescent smoking rates. That yes, even though youth could go to towns next over, there was a decrease that was thought to be due to those policies that were passed just at a municipality that did not have surrounding municipalities. So I can't say I have evidence that on how that would affect NFG. I would love to do those studies, but I think it's fair to say that I would fully expect that Ashland passing NFG would prevent some youth from smoking and would likely save lives. I would feel very confident in saying that.
Thank you.
Thank you.
I too want to thank you for your presentation. I was originally not going to say anything because a lot of it has been said. But as I'm sitting here and listening and just thinking back to some of the other decisions that we as a board, not all of us sitting here, have made, we made decisions as a town, as you said, Tobacco 21. We also made decisions about marijuana to not allow first medicinal marijuana, and then because of that, we then didn't have recreational marijuana. So I go back and forth. I'm one of those people who looks at both sides. I think more research might be necessary. I do consider our retailers as, you know, they could lose the business. I would be interested if we could talk about or find out from Brookline. I'm also going to reach out to the other communities in the Metro West Regional Collaborative and say, what are you looking at? Have you looked at this? Because if we know that we're doing it as a region and not just waiting for the state, then that could be helpful in regards for me, for making a decision as well. So, but you did say that Hopkinton has passed this already?
Yes, ma'am.
Okay, yeah, so then, yeah, so we are part of the Metro West Regional Collaborative, 9 communities, which surprisingly does not include Hopkinton, but Holliston, Framingham, the west, you know, the boroughs and stuff. But if you have information on some of those, that might be good for us to know, because I'm also of that mind that if we don't have it here, they could go to another community. Now, that was one of the rationales we used when we said no to marijuana, was, okay, even though it's not here in Ashland, you could go someplace else. So it's sort of a catch-22. But information would be great if you have it.
I'm going
Please.
to let Professor Silba, yes.
Hi, I really want to thank you guys for letting us speak tonight. I just wanted to say that the question of going next door, there's really quite solid research from Tobacco 21 that there was a 50% reduction in local use, even when all the towns around were still Tobacco 18. So while you probably are seeing this in Ashland with respect to cannabis use, that no, you don't get, it's not perfect. But a 50% reduction is nothing you ever see in public health. I mean, it's really remarkable. And there's also a lot of public health research showing that proximity really does matter. Sure, determined kids get alcohol under 21, they get tobacco. I mean, determination helps, but proximity is a really, really important factor. I just wanted to speak to quickly, if I could, to the question of town by town. Tobacco 21, there were about 150 towns that passed it before the state would make the move. And of course, I think everybody thinks that has been a tremendous success. But we're at 21 right now. There's a lot of towns considering this, but it does take the courage of each Board of Health. I also wanted to say that the litigation that happened that went to the Supreme Judicial Court basically affirmed that the boards of health have this jurisdiction to make this regulation under the Tobacco Control Act. What they can't do is just raise the age to 25. That's actually not permitted under the Tobacco Control Act. They can put in place this birth date regulation. Supreme Judicial Court says that is all good for a Board of Health to do, and it's got to be done town by town by town until the state is ready to act. And the reason I raise that research about proximity mattering is that, I mean, you have maybe 800 or 900 kids at the Ashland High School. The Youth Risk Behavior Survey now shows about 20% or 21% of them have used tobacco products in the last 30 days. So the number, we're talking about maybe 40 kids 40 individuals who would be every year who retailers could not sell to at maximum, right? Now, they keep every existing customer. So we're really just talking about 40 new customers a year that they might be missing. The question is, does that impact mean more to the retailer in a future customer, or does it mean more to those 40 people who are going to experience freedom from addiction? Because the freedom question is really tied up in the fact that while you're still an adolescent decision maker, so not really an adult, you're hooked. And according to the CDC, this is as addictive as heroin. It's not addictive in the way that alcohol is, but it's distinctively addictive. And that's why there aren't adults who initiate this, because it's really quite dependent on adolescence. You know, it's really dependent on that adolescent decision making. And then the social networks, where they get it from people who are 21 and they're 18 and they have a 21-year-old in their social network, but they don't have a 26-year-old in their social network. So this can have a serious impact on the health, the life opportunities, the financial well-being of a set of Ashland kids right now.
Thank you. Anything else?
I'd be interested in hearing from other
Yeah.
people in the room or,
Yep.
people online to see, what they'd like to recommend.
That's what I was
where
gonna
I'm
make a, I'd like to save the best for last, so I'll leave my comments to the very end. But I am curious. A lot of people know who I am and what I used to do. Matter of fact, decisions at every turn became a very vocal part of my career when I was leaving that aspect of it. And for those who didn't know, I was the first dare officer in Ashland. I was the juvenile officer, and I took a lot of heart and concern in dealing with youth issues. So you're preaching to the choir here when it comes to tobacco use, okay, or anything of that matter, when it comes to any type of illegal drugs or whatever. But I would love to hear from some members of the Board of Health your concerns and some of the things that you would like to see us probably help change some views. I mean, my colleagues have made some great comments. Their concerns are very valid. And, it's somewhat of a catch-22 a little bit here with respect to that because, again, we're living in a time where individual freedoms are slowly being pulled away a little bit, and I don't want that to be confused with another decision that's being made for people without having all the information to be able to make a wise and healthy decision for them individually and not as a collective group. So I welcome anybody from the Ashland Board of Health to come up.
I'm sorry, Mr. Chair, before Ashland Board of Health gets up, I just wanted to point out to say two
Okay,
things. First thing I just wanted to ask was if it's possible, and I don't know if there are any young people in the audience tonight on Zoom, but it would be great at some
Excuse
point.
me, ma'am, before you go any further, please identify yourself.
It's me.
Oh, I'm sorry. I'm looking up there and I see hand raised. I'm sorry,
It's
Makita.
just me.
Hold on a second. Let me change my
The chair
eyeballs.
frequently denies
Oh,
that
it is
he
you,
knows
okay.
or is associated with me in any way, so this is no surprise. Yeah, I'm
ahead,
actually
Nikki.
a
I'm
little
sorry.
sick. It's okay. So,
I'm looking up there and I see hands raised. I'm going, okay.
sorry.
Go ahead, kid.
One thing I just wanted to point out, and something that Claudia said earlier, I don't know if we're going to have a lot of young people on the Zoom tonight, but I think it would be great to have an opportunity either at our next meeting or have some kind of a forum where we could hear from the young people in Ashland about this issue. I'd like to have some sort of means to do that because they're the ones who are being impacted the most. And we're making decisions as adults here in the community about that. But I think that's the core constituency that we need to hear from about this issue and how we should go forward. So that was the only thing I wanted
That's fine,
to
Makita.
suggest.
The first note on my sheet was make sure we talk to the high school students and have them come in front of us. So that'll be done. And I'll send an invitation up to high school. And I won't look up there anymore. I'll make sure I'll look over here.
Okay, so now do we want to go through them? So the
Yep.
first hand was Alex Wetherall.
Yep.
Unmute yourself, please, Alex.
Okay, can you hear me?
Just a little louder, Alex. That would be good.
How about now? Can you hear me now?
Much better. Thank you.
Hey, thank you very much for letting me speak. My name is Alex Wetherall, and I own a gas station convenience store in Sherborne, next door. I'm also the immediate past president of the New England Convenience Store and Energy Marketers Association. And I'm here specifically to lend support for my peer retailers in Ashland. None of us is an angel. All of us exist to make money serving the public. But none of us wakes up every day intending to degrade public health. During the past 2 years, I've attended more Board of Health meetings than I can remember in numerous towns. And in every one of them, anti-smoking zealots, many of whom are on the Commonwealth's payroll, trot out activist lawyers and eager high school students whose testimony makes the impression that convenience stores are a lawless nicotine pipeline, nicotine in every form imaginable. Oh, it's shameful, they imply, citing one data-free anecdote after another. Retailers are enabling underage kids to consume all manner of toxins in playgrounds and bathrooms statewide. But it's nonsense. The zealot's testimony omits two key facts. One, kids don't get nicotine products from brick and mortar retailers. They get them online, where no one checks IDs. C-stores in Ashland check IDs. Two, the rate of nicotine consumption is plummeting with no help from the NFG zealots. Take smoking. 10 years ago, smokers bought 53 packs a day in my store. In 2025, they bought 27 and a half packs a day. That's 48% fewer, a compound rate of decline of 6.3% per year over 10 years. And the decline is accelerating. Last year, smokers bought 12.4% fewer packs in my store than they had in 2024, the year prior. So hats off to all of you in Ashland, because the 21-year firm age limit helped hugely. NFG is performative public policy that proposes to demonize retailers while making no practical impact on public health in Ashland. And I urge you to vote against it. The last thing I'll say is 21 towns out of 351 after 22 months since Brookline jumped is less than 5% of the municipalities in Massachusetts. So any of you on the select board who have misgivings, you are in no ways alone. This is a performative piece of public policy. It puts the burden on retailers, and it's not good business. Thank you very much.
Thank you, sir. Let's see, who is next?
Stephen Heller.
Stephen Heller? Stephen, please unmute yourself and identify yourself and where you reside, please. Hello?
Good, okay.
No, there he is.
Okay, here I would like to have my video on, but it seems like that is not working. So I'll just speak to you. My name is Stephen Helfer. I live in Cambridge. I'm not honored to live in Ashland, but this is definitely something that is being proposed town by town and on the state level. And as a member of Cambridge Citizens for Smokers' Rights, which accepts no funding from any source whatsoever, I feel compelled to speak about this. I believe the proponents of this policy are really setting on having total tobacco and nicotine prohibition. They are doing it by saying, oh, we're doing it for the children, which is a very often what is being said when you try to push something over on adults. But as I'm sure Dr. Rich and Professor Silva know, that according to the CDC and the FDA, the teenage smoking rate is the lowest it's ever been on record. That's a 25-year low. Vaping is at a 10-year low. And their nicotine pouch use is still remaining very low. So what is being pushed here is total prohibition within a period of time by saying we have to protect the children. But the rates of youth smoking and nicotine use in general are very, very low. This policy does not affect youth at all. It only affects adults 21 years and older. I see no reason why youth who are not smoking now and have chosen not to smoke or vape are going to, at the age of 21, all of a sudden change their minds and decide to smoke or vape when they reach 21. This is aimed at adults. If the tobacco industry is trying to attract youth, it is not succeeding. Incidentally, Professor Silva said that tobacco smoking is like heroin. Again, according to the CDC on their smoking cessation site, they've noted that for every 3 adults who've ever started smoking, 2 have quit. I'm also sure that many people in this room and on this video meeting have known dozens of people who quit smoking. None of them needed to go into any kind of treatment facility. None of them missed a day of work. About the stores in Brookline, I don't think this would shut down any stores, but according to the Brookline News, retailers in Brookline experienced overall sales declines, not enough to close them down, but enough to hurt and devalue their businesses. So I think this is also a matter of public health. For people to be able to earn a living and support their families is also important. Finally, I'd like to say in the state of Massachusetts now, we feel that adults are competent enough to decide whether or not to consume alcohol or marijuana. Both of these are intoxicants. Incidentally, we have 600 marijuana stores in the state. The legislature has just proposed, or actually just passed, we will have marijuana cafes. If you consider nicotine and tobacco, neither of these impairs judgment or compromises driving skills. Also, my last point is, again, Dr. Rich said that smoking is maybe the #1 cause of preventable illness. But right now, the adult smoking rate in the United States is at a 80-year low. So very, very few adults themselves are smoking. And if you consider that 90% of non-smokers die from stroke, heart disease, and cancer, which are classified as smoking-related diseases, I don't see how smoking can be causing all of this health problems when only 10% of the people smoke and non-smokers get the exact same diseases. I would ask you to have the courage not to pass this. There is a momentum, a prohibitionistic momentum that is building, that is saying we need to protect the public. And I think we should allow the public to make their own decisions. Thank you.
Thank you, Mr. Helfer. Appreciate your comments. Next, it'll be Mr. Lopez, Rich Lopez, and I'm going to keep it to 3 minutes, if you would, please. Thank you.
Sure. You can hear me okay?
Yes.
Yes, great. So a lot of the points were made in the presentation that I wanted to make. I'm a retired primary care physician. I live in Reading, Massachusetts. I'm the chair of the Board of Health in Reading, and we passed a nicotine-free generation policy in June of 2024. And so I'm going to try to not reiterate a lot of the points, but I can share some experiences with you. You know, we had a public hearing. It was probably about 2 hours, maybe a little bit more, with heated exchanges back and forth. I think we received about 200 emails, many from the retailers, cut and paste type things, but also pros and cons from other residents as well. So it was a very active process we went through, but ultimately decided to move ahead with this policy. And I can comment on just a couple things. One is, I would say, at least in the town of Reading, over the past year and a half, no retailers have gone out of business. When you think about it, it's 1 year at a time. It's literally a fraction of their clientele, probably 1% each year. So it's a very slow process, as was pointed out in the presentation. But I just want to reiterate that we haven't seen any impact that way. And secondly, with respect to underage use, it is true that social circle, children under 21 get their products, from their social circle and from online. So the big two things. This is not going to affect online purchases. But what we've seen in Reading, 8 to 12% of Reading middle schoolers and high schoolers use some form of tobacco or nicotine. And that represents about 1 to 200 students. And in our thinking, if we can save just a few dozen of those over time, in terms of the ravages of what nicotine and tobacco do, I think it's worth it. I would point out that although smoking tobacco has gone down, the use of nicotine products has gone up. The marketing by tobacco companies to come up with new and different nicotine products. And nicotine, although a little bit less toxic than inhaled smoke, still increases risk of stroke, heart attacks, and frankly, tobacco and nicotine remain, associated diseases do remain a major reason for death and morbidity in this country. One other point I make, so I could wrap it up, was this whole idea of slippery slope, which is a rhetorical argument often called reductio in absurdum or whataboutism. And so what I heard, I think the best reductio in absurdum was, next thing you'll know, they'll prohibit ice cream and Twinkies sales to obese people. And of course, we heard about, what about alcohol and marijuana? Are they next? These are rhetorical arguments, and you will hear, as you go through this process, you will hear these time and time again. And they inflame the passions. They really don't shed any light on the problem. What about marijuana and alcohol? Well, what about cocaine and heroin? You can take these arguments to the absurdity. What we're trying to do here is, over time, over a long period of time, reduce the use of nicotine and tobacco in youth, which, as was pointed out, are really the people who get hooked. And the last thing, and I'll stop, is this whole idea, and I was pointed out in the presentation, this whole idea of free choice in adults, it takes on new meaning with a highly addictive substance like nicotine. And, so many smokers and nicotine users are trying to quit. That doesn't sound like free choice. That sounds like people who are trapped in the ravages of addiction and can't get out. And most of those started in younger people. And so I'll just leave it at that. Thank you for allowing me to speak.
Thank you, Mr. Lopez. We appreciate your comments. Next, Ken Elstein. Okay, Paul Kendall. Mr. Elstein dropped out, I guess.
Good evening, Paul Kendall, 6 Rebernacker Road. I would just like to say a few things around this. One, just would encourage you to continue to foster conversations around it, hear from the younger people, hear from these other people, and not just from the proponents or people against it or anything like that that have bias in this case. You've probably all heard me speak at town meeting, particularly around things that do start to limit our choices or our freedoms, things like that. And I'm one of the people that feel very strongly about being careful when we craft any policy that restricts freedoms and choices. But one of the things that helps me to tip that scale is when it's something that has something like this with public health. And it doesn't just impact the person who's smoking or vaping or anything like that. It impacts our healthcare system. It's one of the reasons why our healthcare system is strained. And so it impacts us all. And we do have, as was stated before, many different things where we've had to make these choices in the past, whether it be seatbelts. And that's one that is literally for the person's individual's health, right? It doesn't, that one wasn't there for impacting other people. It was to protect that individual. Clearly, it's a little bit different of a restriction on personal choice, but nonetheless, there was good data, objective data that led people to make that policy and those laws and enact them. So I would encourage to continue having conversations, challenge everybody to try to put aside your bias, and whatever that bias is, for or against, right? It doesn't really matter, but really just follow the information and then try to make a decision and it's all about balance, right? We can't always just say, I'm never going to make a decision that's going to limit somebody's rights or choices. And we can't do it either way, right? We can't be black and white on those things, and we have to strike the right balance. And so that's all I'd like to say is let's continue the conversation, but understand that this one is one of those ones where we really have to try to strike that right balance, because it's not just impacting the person that's making the decision, it's impacting all of us. Sometimes more directly than others, but certainly impacting our entire society. And I'm one of those people that have been impacted by these things, not because I've done it, it's because other people's choices. So, but again, I'm not here to say you should do X or Y, just please continue the conversation, seek more information, so we can make a good, sound decision on this.
Thank you, Paul. Appreciate your comments. I see that Ken Elstein has returned. So Ken, if you're available, please unmute yourself.
Yes,
Identify yourself.
thank you. Thank you. I'm Ken Elstein. I'm completing my 6th year on the Belchtown Board of Health, and I also served for 6 years on the Belchtown Select Board, so I basically have occupied the chairs of both of your boards. I also served as president of our County Select Boards Association when I was on the Select Board. I'm 77 years old, and tonight was the very first time in my entire life I've ever been called a zealot, so I have to put that down. So we were the first town in our area, Western Massachusetts, to approve nicotine-free generation. We did it a year ago, so we now have a year's worth of experience. It's been very good experience. The merchants have adapted very quickly. In fact, they find it easier to check the ID cards based on a year rather than trying to calculate how old somebody is. What our experience was, we were the first, and now there are, I guess, 5 or 6 other towns. The most recent town to pass it was the town of Amherst, which is really important because they have 26,000 undergraduates, almost all of whom are under age 21, and almost all of whom have daily contact with peers who are over 21 who are eligible to buy these products. What happened was they were waiting for towns around them to do it. So we passed it Our neighboring town of Pelham passed it. South Hadley passed it, which, by the way, I don't think is on Dr. Rich's list. And finally, Amherst passed it, and we have several other towns around here that have since passed it, not adjacent to my town. I think we probably have 5 other towns out here who are actively looking at it. And I'm really proud to say it's because we were the first to do it. Don't wait for the legislature. It took 175 municipalities in Massachusetts to pass Tobacco 21 before the legislature got its act in order, which, by the way, was passed by a Democratic legislature and signed by a Republican Governor, Charlie Baker. And a similar thing happened in Washington when it was signed by President Trump in December 2020. The people who speak on behalf of the convenience stores, I really actually appreciated it, because by saying that the sales have declined so much, but they're still doing well, is a statement, first of all, that these tobacco control efforts do work. And it's also saying that there isn't, that the impact on their sales is much lower than it would have been if we had enacted this 2, 3, 5 years ago. They're sort of playing a game, though. They say that the $4,000 a year that each smoker spends in their shops should not be spent in your restaurants and should not be spent in your other retailers.
Can I interrupt you for a second? Because
I'll cut off now.
I appreciate that. We have a 3-minute limit. and
Right. Okay,
we
thank you
still
very
haven't heard
much.
from members of our Board of Health, and I would like, there's 2 other people out there, but I would like to at least hear some of our current members of our Ashland Board of Health before I continue to. So if anybody would like to come up from our Board of Health, please feel free to. Yep, absolutely. Thank you.
Hello, Ms. Works. I'm John Burns, Vice Chair of the Ashland Board of Health, and thank you everyone for coming tonight. So I'm just here to report in. We were invited by the Select Board tonight. We're in an active meeting right now. Just report in on a meeting that we had to discuss this issue on December 16th. The long and the short of it is that we felt as a group that this was not clearly a public health issue, that this is more of a personal health and personal choice issue, echoing a lot of what was said in the previous Select Board meeting, and I forget what date that was. But we watched the recording of that, and we agreed with everything that had been discussed at the Select Board meeting. And for us, that's what it came down to. We really didn't feel like it was our place or our mission. So it's interesting to hear from other Board of Health members from around the state. And I think it may be a matter of difference in the way people view what public health really is. For us in Ashland, we see it as very clear. Public health is protecting folks against things like asbestos and environmental toxins and lead and some of the things that we've heard discussed here tonight. This, if it is public health, it is. We just felt it was more of a personal health issue with maybe some public health knock-on effects. But because of that, and because it was questionable, we felt as though an appropriate step for interested residents would be to take use the same procedure that they used in Brookline, which was to pursue citizens' petition, take it to town meeting, have a real democratic process, let the residents vote on it. If it were passed, the Board of Health would gladly implement the measures that were needed to be put in place. So that is it in a nutshell from our meeting on the 16th. And I'll take any questions.
I'll open it up to any board member. Have any questions at this point?
No, I don't have a question, but yeah, I did find that interesting in Brookline that the Board of Health and their Select Board did not take a vote, but then via citizens petition, it was brought to town meeting and passed at town meeting, so. We don't have a Board of Health. Oh, there was no Board of Health, just the Select Board. Okay, but still. Yeah, we don't have one. But still, it was brought to the people to make the
To
decision.
make the decision.
So
Correct, and
that's
that,
where I would be
and
leaning at this point.
I'm happy to have you clarify if I'm wrong about that, but that's my understanding.
If you please speak up to the platform, because many people
Yes.
that are watching can't hear you. Thank you.
I mean, we're just organized a little bit differently in Brookline. So I just want to say, we don't have a Board of Health. Because we were the first in the state, we just chose to proceed this way. But I just want to reiterate that once this got litigated through the Supreme Judicial Court, it just became clear that the appropriate body for this under the Tobacco Control Act is a Board of Health, if you have a Board of Health. So this is tobacco regulation approved under the Tobacco Control Act, pursuant to the Tobacco Control Act within the jurisdiction of boards of health. So that there was just a special procedure because we went first and because we're organized differently. I do want to say that we don't have any towns yet that have brought this forward to their boards of health and have rejected it. So though it is only 21 towns right now, it's definitely on the move forward.
Thank you. Thank you for that clarification. Appreciate that.
Yep. Any other questions for the Board of Health?
No?
So I quick question. So if there was going to be, whether it's a citizen's petition or if, as we were talking about, that the Board of Health could potentially decide to bring it to town meeting to sponsor, okay.
That's just to be clear, what we were saying was we would then implement and enforce what was brought to town meeting and passed
Gotcha, okay.
by somebody else.
Okay, but you're not looking to sponsor anything at
Correct.
town meeting? Okay.
Correct.
All right, sounds good. Because I was going to say, like, I think one of the things that we were hearing here today is just that there's so many viewpoints and probably a small fraction of opinions. And I think I agree with the Board of Health. I don't know if I feel comfortable making a decision, for the entire community without having the entire community really be able to weigh in on it. So.
Yeah, and the rest of the board can,
Yeah.
I think, flesh that out a little bit more if you folks want to. I was just reporting in on the discussion.
So-
But there was quite a discussion about it, so.
Okay, thanks.
Yeah. Do you want to? Thank you.
Well, we got our words in.
Yeah, plain Ed head. So when our board discussed this at length, we just felt really the five of us should not be the deciding factor here. We really felt, and that's why we had asked Raj to bring it to Michael's attention to get in front of you, because we really think it should be a town vote, something at town meeting. We just felt the five of us really, it's not up to us to make that kind of decision for the whole town.
Should we decide to have public forums, would you folks be available to provide information if need be?
Sure,
I mean, you folks are the ones that are going to be monitoring this, I would assume.
Correct.
Where it falls under your purview, then I would assume that it's either you folks have something that you're going to support it on in some way, shape, or form.
Right.
I know you're all individuals and you have your own feelings about it, and that's fine.
Right.
But as a board, the town would expect to take some guidance as to, what you think would be possible.
Right, and then someone obviously to sponsor it
Correct.
at town meeting.
So it's interesting, I just pulled up some information from Amherst. So for Amherst, it was their Board of Health that actually took the vote to make it a policy, and it's as of January 1st, 2026.
Now, Doc, were a lot of the towns that voted this, and thank you, Woody, I appreciate the clarification, did the individual Board of Health vote this in, or did it go to a town meeting vote? I'd be kind of curious as to what those numbers would be.
I believe of the 21 municipalities that have passed it, 19 were passed by Board of Health, and the only exception being Brookline and Newton.
Okay.
And Newton was City Council,
Oh,
yes.
okay.
They have different
Thank
forms
you.
of government.
I know, young lady, you had a question. Come on up, please identify yourself, and thank you. Yep.
Hi, I'm Susan Brostrup Jensen. I'm a resident of Ashland, 355 Cedar Street. I actually didn't come here intentionally to address this issue, only heard half of your presentation. But I have a few comments related to it largely, but also I had a question for the Board of Health, actually, too. So I'm not sure where I should start or if I should separate those two things.
Well, you have 3 minutes, so I'll let you decide
Total?
what you want to do.
Okay. All right. So I grew up in a smoking household. My sister was a smoker. I watched my mother try to quit. I watched my sister try to quit. I've seen the impact on people's lungs as a result of smoking. I'm personally not a smoker. I've never been a smoker except when I was in second grade, and my friend and I would like sneak cigarettes from her older brother out in the field. So I guess my question for the Board of Health is, I was shocked to hear you feel that smoking is not a public health issue. Given all the rules that have changed around smoking since I was a child, where you can't smoke in public, there's all sorts of places where it's banned and things, and there's all kinds of impacts, as we were discussing, about health impacts and on our healthcare system. I'm really shocked to hear that you don't consider it a public health issue and under your purview. So just a comment on that as a resident of Ashland. And then I also want to just apologize to the folks that were presenting. In addition to losing our sort of rights and opportunities through our current government, we also hear a lot of inflammatory rhetoric directed at people who challenge things. And most of the dialogue here has not been like that, but there was one particular person that was highly inflammatory, I thought, and attacking in their language, and I want to apologize for that. They were not an Ashland resident, so that was nice. I do also want to talk to the idea of culture change and the importance of culture change, and I think as laws have changed around smoking, we've seen that change happen. That may be why less people are smoking now, because there has been a culture shift about smoking. And as a result of this kind of legislation that we're talking about, or these kinds of rules that we're talking about, that's how that happened. And so in continuing to protect people from smoking and exposure to secondhand smoke and things like that, we're continuing that culture shift around smoking, which will hopefully eventually lead to less and less people smoking. I also want to address the data on the number of students who are currently using. Based on my experience of my children going through the high school, I would say that number is far lower than what's in reality. I think people are not telling the truth on some of those questionnaires. And I think overall this sends a message to our youth that we're here to protect them and support them, and it doesn't matter if another town makes something available to them or not. What matters is what we, as the town of Ashland, the message we want to give our youth. And I would encourage us to be courageous around taking a leadership role in Massachusetts for that. It is a domino effect, and you need to be willing to be the first domino to fall to cause social change. So I would really encourage us to be braver as a community in that regard.
Thank you.
I don't want to follow you.
Okay. You're going to be the last. Yep.
I guess I got up at the right time then.
I would say we should ask if there's anyone else, and they should stand up, and,
Okay.
and we still have someone online as well.
I don't see the hand
We'll
raised.
keep you to-
Where is the hand raised?
Yeah, Jonathan.
Oh, okay, I'm looking at that screen.
It's hard to see it on the.
Oh, okay. Thank you. Go ahead. I'm sorry,
Okay.
Amy.
Okay, no, all good. Hi, Amy Turncliffe, 21 Rossi Lane. I live in Ashland. I am a neuroscientist and public health advocate and parent. I just prepared some notes as we were sitting. So I want to say, first and foremost, nicotine is no ordinary commodity. So we're not talking about anything else, right? We're talking about a substance that has significant addiction potential. These are products that are engineered to addict. They cause significant public health harm. The nicotine industry is continually developing new products that appeal to young people who become lifelong customers. I personally believe that addiction is one of the most significant public health issues of our time, and I respectfully disagree with our Board of Health. Freedom from addiction is what we're after, and those of you who know me know I've been doing this more than 15 years. For my kids, for your kids, their peers, and down the road, their kids and grandkids. This policy will impact adolescent perceptions in a positive way, which is associated with a reduction in use. We need to think about long-term positive public health impact, and that's a significant legacy. I think it can be yours, it can be ours. I chair a regional prevention coalition in Metro West. Several of our Metro West member coalitions, including our neighbors, are discussing nicotine-free generation. Ashland has been a leader in nicotine tobacco policy. Tobacco policy sits with the Board of Health. And I think we should lead on nicotine-free generation as well. This policy would have a positive impact on norms around nicotine use in our community. This is a major public health issue. I believe, again, that our Board of Health has the power and knowledge to implement nicotine-free generation policy, like more than 20 Massachusetts citizen towns have already done. I have found, those of you who know me know I do a lot of policy work specifically around substance use disorders and mental health. This is a very high education issue where it's very hard for the general public to fully understand in a short amount of time the public health implications. So I really do believe it's our public health experts that need to take action. Thank you.
Thank you, Amy.
Thank you, Amy. My name is Scott Francis, and I live at 17 Maury Drive, Ashland, Mass. I invite everybody to come over to talk about nicotine-free generation if you like sometime. I love living in Ashland, and I also am blessed to work for more Massachusetts Organization for Addiction Recovery that supports the nicotine-free generation legislation, municipalities and statewide. I'd also like to provide some direct testimony about, I'm a person in addiction recovery and trauma recovery, and the consequences of tobacco use. That has been my toughest addiction to have to overcome, whether alcohol or marijuana. When I had a return, I went into addiction recovery in October 5th, 2006, and when I had a return to use, it really, it set me back a little bit. I had, a setback, and then I was able to get back into recovery after, a short return to use, right? And so since September 22nd, 2007, I haven't used a substance. And the reason why I point this out is that my return from use from tobacco, which I started using before my brain was developed, and I was really experienced a lot of trauma, and it was given to me for free. When I had a return to use for that, it cost me thousands of dollars in years. It wasn't like I had 4 nights of using alcohol when I was traveling. This took me years and so much money away from me, and it affected my health. And I did miss days of work because smoking, I developed bronchitis. It impacted my health. And also, smokers' rights. How about people have a right to not be secondary smoke? What about that? I really feel my self-determination ends when it infringes on another person's self-determination. And I can't help but wonder, like I too was going to grocery stores with my mom, and she would be smoking in the car, and all that stuff that happened as a result of that secondary health. Secondary smoke, it affects our health. Mm-hmm. So I'm asking, I have 2 small kids. In fact, some of you might remember Jack testified this summer, and he's in the middle school, Ashland Middle School, and he's asking to please support this and pass this because he doesn't want to have to deal with this. And, so I think I'm glad we want to have the youth voice heard, but I beg of you to really consider the negative impacts and why is it okay to use a product that kills people and affects people's health. I just don't understand it, but please, I beg of you to be fearless in supporting this nicotine-free generation and to, do the right thing. So an ounce of prevention is worth more than a pound of recovery, even though I believe recovery is real.
Thank you.
Hi, I'm Chuck Lids, 150 Oregon Road. I'll be very brief. This is personal for me. I remember from the time I was old enough to notice my father smoking. My father was a physician. He, in 1956, 55, the first major report linking smoking to lung cancer came out. He decided he was going to quit. So he started trying to count the number of cigarettes every day, and he'd reduce it 1 a week. And then he couldn't go any further, so he started smoking Kents because they had a filter on them. And then he went up again, and then he went slowly down. And then he went to another brand of cigarettes that had, and this went on, and then he eventually went to small cigars. This went on long enough so that I was in college before he could quit. And this is from a physician. This is, to say this is addictive is, not, the other thing I want to say is my closest friend from college died from lung cancer from smoking. So it is personal.
Thank you. There is one additional person we'd like to have. Jonathan, if you would unmute yourself and identify yourself and where you reside, please.
Hi, my name. Oh, sorry, I was trying to turn on the video. My name is Jonathan Bowen Leopold. I actually volunteer at Cambridge Citizens for Smokers' Rights with Stephen, who's on this meeting too. And my message is very brief. I absolutely love to smoke. I've always found smoking to be very helpful for my mental health, being a good citizen. I really don't see otherwise. And, I just don't want to take away counting on something honest like smoking from, future generations. So that's it. Thanks.
Thank you, Jonathan. I think we've
heard from everybody.
We've heard from everybody so far. Okay, we will definitely take this under advisement with all the things that we have to do. I believe that we have a lot of work ahead of us with respect to this to get this either passed or not passed and put it in the proper forum. And I don't disagree with putting it on a ballot and having the people vote on it, or not on a ballot, but at town meeting, and have them. I think that's the proper forum for that to happen.
I would I would recommend for the Board of Health to do some kind of public hearing.
Yeah.
At a time where students or other people who are going to be impacted by this, I think we had a good turnout tonight, but I think it would be good.
Yeah.
My mic's on. Sorry, I'm
Yeah.
just being soft tonight. Usually. So that would be my recommendation, that we do another public forum. And specifically reach out to people about this and let it just be focused about this.
Thank you.
Yeah, and I'll add, I second that. I would certainly like to hear from students and, people who are currently living, with this. And one thing I sit here and I think about is sometimes we talk about protecting rights, individual rights in this country. And sometimes ultimately, it doesn't seem like we're protecting individual rights, but we're protecting the rights of tobacco companies to make, I can't even put a number to it, on the backs of people and youth and eventually adults. We protect the rights, we call it individual rights when we talk about, guns and even when we talk about 40B developers, we're not protecting the rights of, or helping people with housing. We're helping developers make
money.
Profit, make money. And so we talk a lot about protecting rights, and often, if you really drill down, it's, we're not protecting individuals, we're protecting large companies and profit-making enterprises.
Well,
Makita.
yeah, the only thing I want to say is that, again, I just want to emphasize, I think we talked about high school students being part of the forum, but you mentioned middle schoolers as well, and I know middle schoolers in this community who have friends who are vaping, using tobacco products. It's very important that we hear from those folks too. Because I think if we hear, I think to what Paul said earlier, we're hearing a lot of voices, but I think that's one voice that has not been heard in detail this evening. And I think it's important for the community to understand, understand impacts before decisions are made. And it's a critical piece of that, so.
Absolutely. Thank you, Makita. First of all, I'd like to thank everybody for being here this evening, expressing your views and your concerns. It's a matter, definitely a matter of health. It's definitely a matter that is going to affect a lot of people in many, many ways. My mom and dad were two-pack smokers. My brother and I hated it. We hated smoking. Never smoked in my life. Ate, but that was my vice. But being Italian, what the hell, But I just want to say that I appreciate all your comments. And for those who are called zealots, it's just really, okay, everybody has their, they have their own opinions and everything, and that's fine. We let them speak their piece, and we didn't shut anybody out, because that's the right thing to do. Everybody needs to be heard, especially on a very serious concern like this. Appreciate your coming forward and being honest with your addictions, and it's a daily battle, and I appreciate that, and I understand that completely. So thank you all for being here. This won't be the last time we discuss this matter for sure, and I look forward to being maybe having a meeting with the Board of Health that gets something moving forward, and talking about people who would be willing to get a citizen's petition to present this at the town, or maybe us for that matter, but we'll with that, discuss that down the road. Okay, so thank you very much for being here. Appreciate it. Thank you very much. We're gonna take a 2-minute break so that folks can leave if they want to leave, so they don't interrupt us, if you don't mind. Good evening, and thank you. We returned, we're back in session. We took a little break. We had a very long discussion and a very dynamic discussion about a very difficult topic. And next on our agenda,
Is this, sorry, is
I
is
would
this
like
somebody's
to
wallet?
introduce Rob Shear.
Hold on. All right, it's Susan.
Oh, okay, Susan, that's good, that's good, that's all.
Very good, all right. Phew.
It's a good thing we have an honest man up here.
Yeah, well, I checked, there was no cash in there, so. Man.
Rob is here representing a group of individuals who came to a discussion about creating a subcommittee for a resolution regarding Elon Musk. And the forum that they were going to present it in was, we didn't think it was an appropriate forum at that time. And they were willing and cooperative and removed their petition from the fall town meeting, and we greatly appreciate that. And we thought that this would be a better forum to discuss matters, and if it has to go further, then we can take matters, you know, in another direction for a more positive way. So, Rob, I will hand this over to you. Are you going to be the only spokesperson tonight, or are there going to be others?
People can come up as they feel.
Okay, yeah.
I can make, it depends what we end up doing, but I'm hoping this will be fairly quick procedural. Again,
right.
thank you, I'm Rob Scher, and, you know, I'm here with the other members of our ad hoc citizens group. And just, Joe, you did a quick review. I'll just say, you know, I think we all remember that we had proposed a citizens petition at special town meeting about town not doing business with Elon Musk, and also not using the X platform, and also writing a letter to the Middlesex County Board of Retirement regarding the investments. And so at that time, we had a number of kind of individual discussions with various board members, and also came to see you guys, I think, twice maybe, and you know, and agreed that you had a number of concerns, but also did indicate that there were some actions you might be willing to take, not exactly, maybe not exactly what's in the citizens petition, but that you would try to address some of these issues. So in good faith, we, you know, are taking you up on that offer, and I had made a proposal that you appoint a subcommittee to meet with 3 of our folks, and we met last few days ago and did select 3 people who were here tonight: Bethany Robertson, Ed Kirchberger, and Chuck Lids, and they're all here. And so our proposal is that as we get into the kind of nuances and complexities, it's best to have a subcommittee that will maybe meet, you know, that will meet offline and kind of come up with recommendations, discuss and collaborate, hopefully, and come up with a set of recommendations to bring back to the full board over the next, say, few weeks and months, you know, prior to the annual town meeting. And the thing I think would be useful for me to add is our own, you know, as ever-changing events, and in some, you know, you could see that things seem to be getting even, you know, people have made a number of allusions tonight to rights, and, you know, I think our concerns are even accelerating about what's going on. And one thing that we are thinking are, you know, it's not just Musk, it's kind of this whole kind of corporate and billionaire environment and their activities, and that perhaps, you know, one of the issues that came up with talking about one individual who's bad enough and is still misbehaving pretty badly. He's doing some things just recently. But maybe it's more like, and I'm just throwing this out, our thinking is maybe we need more like a code of conduct, or you know, ESG principles, or you know, what's ethical investing, things like that. So, you know, so maybe we're talking, rather than singling out an individual, we're more defining conduct, our practices, our goals. And so that's kind of the direction that we've been moving in as a group. So I just wanted to throw that out as a potential area of exploration for this subcommittee. So that's pretty much, you know, I don't have too much more to add to that. I was just hoping that you've thought about, the members have thought about it, and you have at least 2 members are willing to work with us on this over the next, say, 8 weeks or so. And that's pretty much, I don't know if folks had anything they wanted to add about that, or?
Well, in looking at your proposition that you proposed for tonight's meeting, under tasks and goals, it says the task is to review, discuss, and formulate actions to recommend to the select board. And the goal is for mutual agreement as to specific actions by the select board addressed on the warrant article. But what value do we have other than our voices being raised? No different than the citizens that are out there on Sunday morning on the sidewalks holding their signs, expressing their concerns and, distrust with what's happening. And it's just not here, it's throughout our nation. And now looks like it may be global very shortly. So,
what's your role in this, is what you're asking me?
yeah, basically.
Yeah, I think that's a great question. Well, the way I see it is that you are our elected leaders in this community. And so, and I think many of you feel that way, that you have a leadership role to take. And that was kind of the discussion that we had, that the select board has the power to do certain things, or to make a statement, or to take action to reflect the concerns of the community. And so that's why we're focusing on you guys. We started with town meeting, and we're willing to go back to town meeting, because I think town meeting also has a role. You saw today, you were discussing them doing the tobacco-free generation resolution. But so town meeting can have a role, but I think what we got from talking to you folks, I don't know, a few months ago during this, was that you felt you had a role as well too, and wanted to have a chance to perform that role, or at least take some action. Not the same as what we were proposing, but something in that direction. And I've suggested that maybe, some cities and towns have ethical purchasing standards or ethical investment standards. One thing, for example, I'm trying to get a meeting with the state treasurer, Dave Magnani and I. You may know him, Joe, from somewhere.
I think so.
Are going to try to meet with her. Well, she's done some really interesting things with the state pension fund. They have a stewardship and sustainability committee with goals, and I'm trying to remember. One is pay equity, the other is sustainability, climate sustainability. The other is forestry, sustainable forestry. It's not super strong, but they have this they're starting to develop this kind of screening for their investments, which I thought was really interesting. And to me, that's kind of a thing to encourage her and support her on, and try to push her as an advocate, to push her even more in that direction, and the Prim board, who, So that's, to me, that's an example of a role that folks can take, and you as community leaders can also take that position, and we're willing to help with kind of the technical aspects, like the environmental, social, and governance goals and stuff. I know everybody's pressed for time, but we can help with those kinds of principles and standards that are being developed. And you have a voice to say in that. If you write to the Middlesex County Retirement Board, like, we like these kind of thing, we think you should be pushing it and implementing it, for example. So I'm just speaking kind of off the cuff about ideas that have occurred to me that this subcommittee could take on and develop.
Yep. Well, you and I have had similar discussions, not in depth, but with respect to county retirement and some of the things that I have to be concerned about, because I don't want to fall into an ethics issue, because I am a member of the county retirement.
Sure.
My retirement comes from there. So any actions that are taken, if it benefits me, then I basically affected an ethical issue. So I would have to recuse myself from any and all of those discussions. And anybody that's a member of the county retirement would have to do the same.
Well,
or if they're not, they put themselves in a very difficult scenario. So,
well, certainly that's something we should investigate. I'm a member of the state retirement system. I feel I can advocate for whatever practices I feel like. So I feel differently from you, but we
I
could
could,
certainly
well, it's
look
not
at
that I can't discuss it, I just can't take a vote on it,
Yeah. Okay,
because that vote would affect
sure.
my actions as a member.
Well, I
of
mean,
the-
I think we could get some clarification about that, from
Yeah.
the ethics, because it
believe
would
me, I did.
potentially impact me too, so I think we
Yeah.
could get clarification.
I think we're going to have to get clarification as it pertains to the three of you before, we move forward, honestly. But I think just going back to what Rob was talking about in principle, basically having an idea of like maybe putting a working group together. Sorry, I'm getting over a cold. Putting a working group together to just kind of look at kind of stepping away. I'm just repeating what I'm hearing. Kind of stepping away from talking about individual action, but more or less like looking at how the town could look at some guidelines around purchasing, et cetera, in various different areas that would obviously have impacts on some of the issues that you care about, but may go beyond that as well. Is that what I'm hearing?
Yeah, and I think, use this as a basis, but understand that events are changing. I think we're getting to be a little more sophisticated in our understanding of, and the issues that you folks brought up about, not bearing arbitrary, defining, what's proper conduct and what's not, being objective. So I think that's the kind of direction we want to go in. And you folks, and I know you're very busy, believe me, I remember that. But it'd be great if at least, if two of you were willing to work with us for hopefully a short period of time to put something together.
Joe? So when this was first brought up, I had no interest, because to me, you were looking at one person because of some of the things he did. But you brought up an interesting point, and I was able to just look. The idea of looking at our procurement from an ethical perspective, right? So we're not just, to your point, talking about one person or one company, but looking at how do we as a town want to do our procurement. Just like we talk about being a green community, and we make decisions when we're creating buildings or planning things to take that all into consideration, right? We have our information about being a sustainable community.
Yeah.
And what does that mean? Well, it's not just about energy, but there's other things that you need to do to be sustainable. So, I mean, I by no means am stepping up to do this, because that's not possible. But I would like to see the discussion go rather than toward one or two people, because, I mean, business isn't in there. People do businesses to be profitable, right? So I was having this discussion with someone else. It's like, yes, but some people have so much money, and how is that? I'm like, because they've worked or whatever they do, or people support that business, so they're more profitable, so they're going to have more money. That's not a negative thing. Those of us who work with nonprofits, we want people to make money so that they can donate that money to nonprofits. But if we want to look at how we are looking at our procurement from an ethical perspective,
And
right?
investments too.
And investments and things
And
like
use
that,
of
right?
social
What are
media.
we,
Yep.
what do we want to use to support our community, and how can we do that? So I'd be interested from that perspective. And like I said, I just Googled it very quick, and there is a fair amount of information regarding
Yes.
that. So I think if we take it from that approach and then see what happens, that would be my recommendation.
I would agree with you, Yolanda, and I think that was sort of the approach that I think the last time you all came through. I think that's what I was sort of pushing for, and when you came through. So I'm glad to see that you've sort of kind of evolved your thinking a little bit, and kind of even kind of widened your analysis of things. So, I mean, I think there's room to explore putting some kind of there's room to explore putting some guidelines around that kind of stuff. I'm not exactly sure what the most appropriate mechanism to do that is, but I think that's something that we should explore.
Yep.
And I would be interested in being helpful. I don't know if like 8 weeks is going to be long enough, honestly, to kind of put together any kind of recommendations. It might be good for like kind of an initial sort of pass it, what's going on. I don't think anything final would come out of an 8-week kind of, exploration of this, but I think this is something that, in my opinion, we should commit to exploring and putting something together eventually around it.
And I would just say, just to piggyback on what Makita and Yolanda said, so the select board, if you go on the select board's webpage, we came up, I guess it was probably about a year or so ago, we have the Ashland Select Board and Town Management Guiding Values and Principles. And I think, that is kind of the, you look at some of these things, it's like embrace our diversity and kind of defines that, and build a true home. And so maybe there's something that we can include in there that would be sort of our guiding principles. And then obviously there's sort of more of the technical, like nuts and bolts of specific things that we could do, whether it's procurement or whatever. But I think like including it into our value system as a town, I think like, a broad thing about how we, whether it's, governance or whether it's ethical behavior in some ways or whatever that looks like, that how our taxpayer dollars are spent. So.
Well, I do want to say that we did have some specific concerns having to do with Elon Musk, and now I think we're saying it could be broader because there's other corporate interests. So I'd like to kind of try to keep it focused on, I think that's, and you folks feel free to come up here and say what you're thinking, but we want to keep it focused on the current crop of billionaires and corporate misbehaviors and the actions they're taking. And we want to make sure that public money isn't used to support those activities. And therefore, that's why we're having an ethical screen. So that would be, I think, where we're coming from. And, feel free to come up here and say. And we're also, I think, would like to see something moving fairly quickly. I was hoping, frankly, that you'd appoint 2 people tonight and we could start, or they could start meeting with them so we could see if these discussions can be fruitful in a timely manner. I'm not sure that, and maybe if it's complicated but constructive, we can go further out. But I think we're thinking that this would start fairly soon. And that was our hope for tonight, that you would appoint, that 2 people would step up to continue these discussions.
And just to let you all know, if there is a subcommittee, if it's a specific subcommittee, those meetings have to be posted, and meeting minutes have to be taken and posted as well. So if there's 2 or more members of a board involved, like there's
Open meeting
Mass
laws.
General Law logistics that have to be followed.
You guys have anything you want to add to this? No? Okay.
She's looking for the money that was in that.
I just want to, so Susan Brostrup Jensen, 355 Cedar Street, Ashland. I just want to reiterate, I think it sounds like we're all sort of moving in the same direction, which is great. I think we tried to take your guidance, your input, your thoughts into account in our thinking and withdrew out of good faith. I do think, just to kind of emphasize what Rob was saying, I do think we'd want to see like something happening, like meaningful. Doesn't necessarily have to have reached its conclusion over the next couple of months, but like that there's meaningful progress towards that, so that we feel like it is something that's intentionally being picked up by the select board and moved forward in some way, recognizing again, like this is one of many important issues that you're dealing with, and there's more and more things coming out all the time to look at. But I think that was our hope when we withdrew. That was sort of, okay, we'll do this. We're going to try to meet you and have this collaborative process through it. So we'd like to see that kind of and be reciprocated.
Susan, thank you. Well, thank you for everything that you do. I just to clarify, I just wanted to make sure that, because nothing's been started yet. saying that we're going to have X, Y, Z done by this date. I didn't want to get into that kind of trap, because then when you do that and it doesn't happen, or it doesn't happen the way you want, then it's like, oh goodness, we've completely failed. So I think, pursuant to, and building on what you said, I think if we do a subcommittee, I think one of the first things that we'd have to do is kind of identify like what we're actually trying to accomplish within a certain period of time, and plan, what are we trying to do? Let's then figure overall, and then figure out like what your goals are within certain time periods and such. I mean, so I didn't want to make it sound like, oh yeah, we'll just have perpetual meetings and nothing will happen. Like that's not, I don't think that's the intent of what we were talking about up here.
No, but I think,
So
yeah,
I just
but I
wanted
think
to
there's
clarify that.
Yeah, the difference between like, we're gonna have this done in 8 weeks
Right.
versus like, yes,
Right.
we'll be working.
I just want us to,
something
I just
meaningful.
don't want us to set like impossible guidelines and deadlines and such, and then feel like we've failed because we haven't reached them.
And there are other matters too that we have to consider, and Rob, you know this, and being a board member, there's some things that we need to discuss with town council to make sure we stay in the guidelines of what has to be done properly. We have to, we're in the public eye all the time, so we have to make sure we do everything on the up and up with respect to, decisions that are being made or policies that are gonna be worked on. We don't target individuals. That's not what we do. We target ideologies more than anything else, and try to change those for the betterment of everybody. And I know in this climate, it's probably a very difficult thing to do, but damn it, we have to try it the best way we can. We may not be successful in what we try to do. It's David against Goliath right now, to use that model, but be happy to be part of that if need be. I got free time. My wife would love to have me get involved in something else. Just like Marshall is enjoying the fact that you're here, and
She
probably
doesn't
not.
know I'm here. Don't tell her.
Yep. Yep.
No, she does.
Michael does have a question for you folks.
Yes.
Yeah, so I was just, probably a question more for the board. As Joe alluded to, at some point you're gonna have an intersection here where the values and the legal will need to connect at some point. So my question is I think at some point there's probably makes sense to have a conversation with Lisa, and so my question would be, and I think Beth should be involved as the procurement director, but I'm thinking, the conversation with Lisa, do you want to meet first and kind of really have an idea of what your overall values are before you meet with her? Or do you want to do it the other way around, meet with her first and kind of get some
I don't think
parameters?
that makes, I think, first off, sorry, Michael, I did not mean to cut you off.
It's okay.
Second off, I think it goes back to what Brandy said, I think, we have to establish the values, our
Okay.
foundational values, and I think the working group or whatever has to establish that. And then I think the next stop, to your point, is legal, and say, this is what we're thinking.
Okay.
What are your thoughts about that?
Okay.
Before we get too far down
I
the
would,
road.
I would support that, right? That they
Yeah.
need before we bring Lisa in to review something, we have to have something for her to review.
Yeah, there's a question, whether you wanted to have kind of like the guardrails put up first, or do you want to actually go and have kind of like what your values are, like you said, kind of laid out. I think sometimes that is the better way, especially when you're talking about bigger picture things like values and goals, big picture goals.
Yeah, exactly. So I think it's, it gets like that, so.
All right, so we'll plan on that.
Yeah.
Does that sound good?
Well, I was hoping that at least, so do you agree with the concept of having a subcommittee, and when and how would you appoint people to it? Would you do that tonight? We've given you 3 names. I mean, are there, do you support this concept, and are you willing to take action tonight?
When you say
or
willing
if
to take
not-
action tonight to appoint people?
Well, let's make sure, let's determine what kind of body is, is it a subcommittee or is it a working group? And, what's the distinction
between the two.
between the two.
Yeah, that might be a
Let's
question
talk
for
about
Lisa,
that
right?
might be the first question for Lisa, like to find out like what the advantages and disadvantages of what that body, what that group should look like. We could get a quick answer on that.
Well, I mean, I can tell you, so if you want to have one of you, you don't want to officially appoint that person, but if you want to be able to kind of meet in a. Sorry, I apologize. If you want to have a more flexible, structure, a little bit more nimble, I think probably the best thing to do. Well, let me think. I'm pretty sure it's just one, you could only ask one person of the board to kind of work with that group. If you get to two, I think you have to do the formal appointment, and then it becomes a subcommittee and open meeting law and all that.
Does it have to be like one person at all times, or could you have like people tag in and tag out?
No, that's a question. No, I don't know that. I don't know that answer.
I'm just thinking, well, for instance, like, I'm kind of sick right now.
Yeah, I see
I
what
mean, not
you're saying.
terribly, I'm not contagious, you guys, it's fine. But I'm just saying that, like, okay, like, I'm, the person, it's just like, oh, gosh, I'm sick. Okay, well, then nothing really happens because the select board representative isn't there.
Actually, I think that would be fine, because the working group aspect is nothing like official.
Right.
Right? I mean, there's certainly intent behind it
So
by
like, if
the board.
I'm not there, then it's like, oh, hey,
Exactly.
Joe, can you go to this meeting, because I can't.
Exactly.
And that would be okay.
Yes.
But both of us can't attend the meeting at the same time, or can we?
No, you can't attend the meeting at the same time.
Unless we create a subcommittee and you post and take meetings.
Yeah, you can't do
Like
the
you-
working group format with two.
Right.
So, I mean, I don't know.
Could you have,
Sorry.
somebody who is doing it regularly, and then have somebody else drop in because you kind of want to stay informed, you know what I mean? So would be great to have Makita be our point person, but, I know Joe and I know I would like to maybe attend once in a while and hear what's the conversation like, so that I'm sort of on board before.
Right,
Yeah.
like,
Then you should,
The only,
then you
the
should
only
tag
thing
out.
is, I was gonna say, the only thing is if, because you're gonna be discussing something that's gonna come before our whole board, you can't both be there.
Good point.
All right, fine, it's a
If you were
subcommittee
talking,
then, I
if you were
guess.
talking
Unless
about
it's
hanging
a
out at the
subcommittee.
farmer's market next weekend, that's a different thing.
Right.
But if.
We'll be there.
I know, I'm just-
Bring your shovel.
We'll call
all
for
these
that.
people are gonna show up at the farmer's market next week. But that's sort of the thing. If we're gonna deliberate on something, it only can be one person or two people for a subcommittee.
All right,
And-
we're gonna have to do
And
something.
it can't be an appointment,
And it can't be an appointment.
like an official appointment. You can do that. I like the point person phrasing.
Yeah. Okay.
So do we feel like we need to run that by, I think we understand, right? If it's one person, it's a working group with three of their members, and then, Makita can't be there, so someone else goes, that's fine.
But no
But-
votes to
but
appoint
Nothing, right,
anybody. or
no,
anything.
right, unless we want to make it a subcommittee and say, okay, two people are going to be there, it'll be posted, there'll be minutes taken, so that if people want to know about it,
Well, maybe you start with
working
it's
group.
not,
Maybe
it's
we
just a
start with
working
the
group,
working
and if you
group.
decide, look, it would be good to have two of us present.
And maybe that's the first meeting. Maybe we just do a working group. Let's do a working group meeting, and let's kind of talk through not values, but also structure, and kind of figure that out. And then we come
Then
back,
evolve
we
it
can
into a
figure
subcommittee.
out.
Yeah.
Yeah, probably, yeah.
Eventually you say,
I have a
I
feeling that that's the direction that we're probably
I
gonna be
think-
going.
Yeah, I was gonna
But
say, I think at some point, we're gonna want this as a subcommittee, so that the discussion and that happens becomes public record, right? So people can go back to it and say, well, what was talked about, and rather than have it just show up at the select board meeting.
you know what, I actually, now I'm kind of leaning just towards a subcommittee at this point, because we want to make sure that we're being transparent about this, and I don't want anybody to say that we're not.
Yeah.
So I think maybe that is the right structure, plus it allows other select board members to attend.
It also allows other people.
And other people to
If they
attend.
want to go,
These
if
are
they want
public
to.
meetings.
It's a public meeting, so people can
They
show
can hear
up.
what the discussion is, and they can give their input.
And I think that's important. So, I don't think we want to, exclude, or rather, we want to be as transparent as possible during this process. So, I think maybe that's probably the way to go.
And I would say from my experience, that we did appoint a number of subcommittees fairly routinely. It wasn't like a huge deal. My feeling is, and I'm not the town council, but you could pick 2 people and vote them in tonight and start this process as a public, as a subcommittee.
The grant committee.
Yeah, regarding the transparency thing, I think you could think of it a couple of different ways, and I don't know if this would help you. If this is a policy that the board would take up, and it would be that would be where the ultimate vote would be taken, you might, especially consider having some of those meetings open in public, just because the virtue of how visible things are. If you're looking at ultimately a town meeting vote for something, which, is very visible,
Right.
and process oriented, you might lean more towards the working group format, knowing the transparency would emerge kind of later in the process. Just a couple different ways to think about it.
Audible sigh. So, audible sigh. Okay.
Rob, if we were to give this a week for people to make their decisions on the, to think about it, you guys, I should say, ladies, are you ready to make a decision tonight? Or do you want to give it some thought?
Like the
Thinking
About,
structure.
how it should
Yeah.
be structured, or?
Like give it a day or two
well,
to
it sounds
figure
like,
it out.
it sounds like we're leaning towards a subcommittee.
So it sounds like to me. Is it-
So I would make a suggestion that we can discuss, like, who might be willing to do it. But if we're going to appoint a subcommittee, we actually have to put names on the agenda and, like, do a formal
So
process.
Okay.
So,
Next meeting, okay.
That's the issue.
We've appointed subcommittees without it being, like, when we talked about grant programs, like the BAA grant, we often talk about that and then appoint the
Just do it,
subcommittee,
yeah.
and the specifics like that
Oh.
are not on the agenda, if I'm correct.
And maybe we should, be doing that.
Okay.
Obviously, there's going to be a little bit more eyes on a subcommittee related to this, I think, out of its origins than something like the BAA grant, so, just
Yeah, bear that in mind.
out there.
So I think Makita hit it on the head when she said, the transparency matter of this is very important,
Yeah,
Yeah. So.
yeah, let's
Yeah.
do it right, yeah.
so are there people that, so I'm hearing, Makita, you would be willing to,
Yes,
yes.
and somebody else.
That'd be
So you'll have to do the
Okay,
vote
great.
next meeting, correct? Is that what we're talking
Right.
about? Yeah, okay.
All right,
That at least gives you some time to think
Yeah.
about it, yeah.
all right.
All right, I would just, we are concerned about the passage of time, and I know everything takes time, but I appreciate you moving ahead on this. So we expect, next meeting, you'll appoint, it sounds like you'll take a formal vote and appoint a
Yeah.
subcommittee, or at least you're leaning in that direction
Yep.
now.
Yeah, and that's
Okay.
on the 21st.
The 21st. That work?
And is the general outline seem agreeable to people at this point, like this structure, with the 2 and the 3? Or would you prefer something a little different, or any thoughts on that?
No.
That's fine.
To me,
I
Okay.
don't like
great.
it, yeah.
it's a
You
odd
don't want to
number,
make
and
it
that's
too
fine.
big,
Yeah.
you know that, right?
Okay.
You
You
have
don't
too
want to
big
make
of a
it too
committee,
big.
and
You don't want
it's
it too
hard to do
small,
anything.
you don't want it too big, yeah,
So,
want it right
do we
size.
know before the next meeting who's going to?
No, on
No,
the,
they
We'll
have to
see
vote
it
in
on
open
the
meeting.
at the
Yeah.
next meeting, we'll put it on the agenda that we'll have a vote, and people will determine who they want to do it, and then we'll vote those people in.
And you'll need the names, the proposed other members.
The proposed
I'll
other
send those
members
to
from you
Susan.
guys, that would be
Yeah.
good to
I'll
have.
So if
send
you
them to
shoot an
Susan.
email off to me, Rob, that'd be
Yeah,
fine.
okay, great.
All right, great.
All right, thank you all.
Thank you very much,
And
everyone.
Nice seeing you all again.
Yep, same here.
Happy,
Happy New Year.
anytime you want to talk about the MBTA, let me know. Not to change the subject, but,
No, you're not. That's fine,
all right, thanks, everybody.
as long as we don't get 3 stops every
Have a
day.
good rest of the night, yeah.
Yeah.
All right, see you.
All right, thank you, everyone. Appreciate you all being there for that. Okay, moving right along. Time to open the annual town meeting warrant guidelines. Right? Right? Hello. Hello.
I said the same thing. So I'll turn it over to Catherine.
Time doesn't stop for anybody. Okay, right? Yeah.
No, you're good.
4 months from today is 4 months from today is town meeting.
Okay,
So.
Catherine, you're on the block.
All right, so hopefully tonight we will open the warrant, and so we have some guidance that is included in your backup. So we will send that out as long as it is open tonight. So February 27th is the deadline for the notice of intent to submit proposed articles. February 27th through April 24th will be for select board presentations and discussions. February 28th through April 24th will be public hearings, if any. On March 23rd, 27 is, nope, that should say 26, not 2027, is the deadline for finalized proposed articles, so any changes need to be in by March 23rd. April 1st, we'll have the warrant in front of you so we can vote and close and then post the warrant. April 27th, we are going to have Finance Committee recommendations. The 29th, the warrant's posted. And then May 6th will be annual town meeting. And within the guidance, it just gives everybody the my email address so they can send me any of their proposed warrant articles. And that's about it. Any questions?
Nothing new.
I have one. I know we have a lot going on, but do we want to try and post it a week sooner? A week before town, I know we typically do, but I don't know. I'm just putting it out there, asking the question, and.
Yeah, so Yolanda, which date specifically are you looking at?
Well, so right now, we're looking at, have the warrant posted no later than April 29th.
Yeah, so we're hoping to actually post it, I'm sorry, on the 1st. But Catherine wanted to put that's the latest you can post it, is the 29th.
Okay, so we're hoping, because we're not looking for Finance Committee recommendations until April 27th. And again, that's just a week before town meeting. I think that.
It should be 10 days, I believe. And then
1, 2, 3, 4, 5, that's only 7, right? Because that's the Monday, and then town meeting is the 6th. I just know that there's going to be a lot of financial stuff on this town meeting warrant, and I'm wondering if we want to have it, if we can, certainly the Finance Committee recommendations a little bit sooner, and so that we're not waiting into the last minute on budget decisions, because we know we're going to have a few options available to the community, and the clearer and sooner we can get that to them, I think would be better. Can we plan on having those financial recommendations no later than the 22nd, because that's 2 weeks before town meeting, instead of the 27th? I don't know. Something to think about if we need to.
Good point.
Yes, for sure. So after the last town meeting, we did a debrief with Adam just to talk through all of these dates and deadlines. And one of the suggested deadlines was at least 10 days, 10 calendar days.
Yeah.
So it is 10 calendar days. But we actually want to have it posted April 1st. And then once it's closed, it will be posted. And then we plan to meet with Finance Committee. My goal is to do it either that week or the week after. And so my goal is to try to have it done a lot sooner.
Right.
If
we could have a final 10 working days, because, people, I not understand calendar days, it includes the weekends, but I don't know, something to think about, if we could push it to the 22nd instead of the 29th.
For sure,
Like
and
you
you'll
said,
you'll
it's
notice.
nice to have those recommendations way ahead of schedule instead of
Yep.
2 days before.
And there are some new deadlines on here, and that was
Yeah.
just something that we're trying to hold ourselves accountable to, so
Yeah.
that there's hopefully not as many changes towards the end.
I
We'll
mean,
see if it works.
you know, special town meeting, we were looking at changes till the very last minute, right?
Right,
And
right.
again, circumstances, what we were looking at, different things like that. But I think we need to, if we want the community to feel confident in the information and what we're asking them, we need to make sure that we have accurate information going into it.
Yeah, I think, I think with the exception of having to create a second town meeting, essentially, you know, it was a very similar process. It felt very similar in terms of rhythm and just, you know, kind of chaos towards the end. But yeah, the second town meeting really kind of, that's a new one for us, so.
And again, that to me, you know, and again, you guys have done a debrief. We haven't heard a report on that debrief. I mean, how did we even get to have, I mean, I know some of the details of that special town meeting, within the town meeting. I mean, I think people did very well with understanding it once we got there, but it was, I'll admit, a little disappointing that we got as far as we did, and then it was like, oh, well, it wasn't, we didn't quite have everything right, so.
Yeah, actually what we did is we rushed it, and we had the board close and post it before we typically do. And so what happens is, once that's done, you can't make any changes. And so that's how we
Then
had
the
to
other
do it.
thing I would say is, yeah, we meet twice a month, but if something needs to be pushed by a week, we do virtual meetings all the time. Rather than saying, oh, well, we have to do it by this time because that's when we have a meeting, and we don't have a meeting for another 2 weeks. Okay, let's add a meeting to discuss this particular item. I mean, maybe that's a way to handle it, rather, because Michael, you're saying we felt rushed because we had to get it posted.
Well, I mean, we internally, we pushed that. Like I said, we pushed it faster than what our typical cadence is. And that was the price that we paid for it, is that we didn't have that flexibility when we did discover, you know, oh man, there was a mistake here.
Right.
We had to create that special town meeting to do it, as opposed to be able to just change it before the board, you know, posted. So
Both things to think about and look at.
yeah, definitely.
And determine.
Definitely.
Okay, I move that we open the annual town meeting warrant based on the current guidelines, and this will be for the annual town meeting happening on May 6th, 2026.
I'll second that.
All those in favor?
Aye.
5-0. Unanimous. And thank you for preparing all of that. Thank you, Catherine. And Michael, appreciate that.
Did that one.
Next on the old new business, discuss Project Matrix.
Yeah, I realize we haven't discussed, you know, some of our larger projects, you know, that are
in the pipeline,
that are actually, you know, being worked on and actually starting to, you know, a lot of progress has been made up into the winter. Of course, now with the seasons changing, a lot of activities stopped, but there's still a few things going on. So just with downtown, you know, we're still in the process of making those underground connections, working with Dago Electric and Eversource. I did get a good update from Diane today that Eversource is telling us that as soon as those things are ready, those connections are made, then Verizon, Comcast should be ready to do their piece, start taking the wires down, and then the poles will start immediately coming down. And so what I've talked to Diane about now is just kind of making sure, and as we get some more fidelity as to when the date those poles are coming down are, we start timing things up so we can come in and do kind of like that final refresh after those are done, because we'll have to, you know, fill back in with concrete or brick depending on where the poles are. And just, you know, I'd like to do some power washing and everything, just kind of spruce everything up before kind of like a final unveiling. So That is really moving forward.
So are they all running off of the underground utilities now?
Not all of them, nope, nope.
Some of them are as,
Some of them are, and then some they're doing like testing, everything, and making sure that
so once
everything's
they,
working.
do they, I guess the question is, do they complete it one by one? Or do they complete a whole group at once where they turn it on?
I don't know. That's a good question. That's a good question.
Claudia, when you say group, do you mean the different utilities or an area?
Users.
Okay.
Yeah, like a block,
Yeah.
you know, almost. But yeah,
But
like,
Eversource is done.
well, they're still doing the connections, and then they
Okay.
have to take their wires down once all the
Okay.
connections are made.
Okay, so they still have not completed all their connections.
Correct.
Okay.
Correct. But they've made a lot of.
50% done, 40% done, 70% done.
I'll get that for you.
Okay, it would be good to know where they're at in the process.
Mm-hmm.
And then, and I guess my other question, sort of follow up with Claudia, is are we waiting for Eversource to finish their connections and then the other utilities will start doing their connections? Or as Eversource finishes, then Comcast can start?
It's really more, my understanding is that they're really like one utility company has to finish before the other
Other
come
one
in
can
and
start.
doing
Okay.
their stuff. Yeah.
Thank you.
So then, it seems like there's a lot left to do then.
Well, you know, Diane's date is April.
What year?
Yeah, of 2026.
Okay.
For the polls to come down. So,
So,
you know, that's,
so I guess, right now Eversource is working, and they have to complete every tie-in before Comcast starts?
Correct.
They go through and complete?
yeah, that's my understanding, yeah.
Okay. And so, when did they start tying in?
December.
Yeah, just
Yeah.
recently, that was,
Yeah.
at the time, I thought that was a turning on the lights type of deal.
Quicker
but it wasn't.
process.
Yeah, so they make sure all the underground connections are good,
Yeah.
and then they start taking, they start firing it up. And I think they have taken some things down where it makes sense, and they can. Like if there's not another like utility or communications provider. And, yeah, I mean, I think they're doing like, 3 or 4 a day. But, there's still challenges, as with every construction project, especially when you got a contractor and Eversource in the town kind of trying to triangulate things.
Yeah.
How about for 10 to 60 Main?
Mm-hmm.
Right, so they have an underground connection right now for each of those buildings, and the connection will have to stay underground, right?
Mm-hmm.
Okay.
Yeah.
And how many, there's Eversource, Comcast, who else that has it?
Verizon.
Oh, Verizon, yeah.
And then I want to say like an RCN, I think they use
really?
like a Comcast or Verizon's wires.
Oh.
Huh.
And then we also have our fiber wire downtown.
Right.
Yep.
So potentially April, polls to come down.
Yeah.
Sounds like a lot to happen between now and April.
So what's interesting is in Hopkinton, it happened like that. Like all of a sudden you heard that things were happening and then the polls were gone.
Yeah, it is like one of those, it almost feels sometimes like legal things where there's no activity, no update, nothing, and then there's a flurry, and then that happens. Flurries,
Not the
yes.
snow kind.
And then Pond Street, I think I notified you that they had found that there was basically some substandard concrete that was used on one of the sidewalks, and they're gonna have to redo that in the spring. But there's a few other things. Some, utility pole work remaining, old street lights, signs, manholes, adjustments.
Michael, while
Yeah.
you're on that subject, I'm going to interrupt you on that.
Mm-hmm.
We got a letter from one of the residents that live off of Pond Street. Who's responsible for the snow plowing of the sidewalks down there? Because that wasn't addressed, and they're still covered with a lot of snow, and people want to use the new sidewalks. They can't because they're covered with snow.
Yeah, so the state we have been, when we can, going in there and doing it, because we're trying to pick up the slack. So.
But the state is actually responsible.
Responsible for it.
Can we bill them back if we go in and do them?
We can definitely send them an invoice.
I mean, if they're not doing it and they need to be done and we do them, worth trying.
You can't get it if you don't ask.
Exactly.
So.
Good point. Good point.
So a couple projects that are completed. Let's see, the middle school field lighting project, that was completed. A lot of the traffic calming measures that we had planned on some of the streets, those street signs, those have been completed. The sidewalk for so Cedar Street, the design's been completed.
For what?
A sidewalk, I'm sorry.
On Cedar Street?
On Cedar Street, yeah.
All of Cedar Street?
No, it's a section from Captain Eames to
East Union.
Okay.
And then High Street. And then High Street as well.
So do these have a time frame for when they're gonna start work, or?
No.
These are just the planning designs.
Yeah. Do we have an estimated cost? I mean, do we, as far as like what we would need to budget for those?
I think we do for Cedar Street, Brandy. I don't know it off the top of my head. I don't have it here. But we don't for High Street yet.
Okay.
But I think we do for Cedar.
What side are we putting it on Cedar Street? The fire station side
Yes.
or the other side?
I believe it's the fire station side.
Okay.
Which is pretty interesting, especially around the Workman Circle camp, right coming out of
Yeah,
Captain
because
Eames.
we're gonna have to put
I know.
It's pretty
extend
tight.
the bridge.
It's pretty tight.
I know.
Let's see. Oh, the Union Street, Fountain Street job?
Yep.
So, the underground work has been completed. Contractor's gonna come in before the 2026 marathon to clean that up.
When are they gonna be done over there on Fruit and Elliott
Yeah.
Street?
Yes.
That's something people ask me about all the time.
People are asking me about
The
that all the
paving?
time, too.
The
No,
pavings?
the digging, they're
Those
still
digging.
doing.
Yeah, I mean, Fruit Street's closed lots of days.
I don't know.
Yeah, it'd be great to find out what's going on over there, because I have been pinged about that as well.
There's a specific crossing guard over there. They'd be very happy to know that answer. Because that's all they ask her all the time. When is it gonna get done?
Oh, I bet they ask her.
They ask her all the time. When's it gonna get done? How do I know?
Just for her son.
Yeah.
I don't know.
I don't know.
We're still doing
I had an
the,
experience like that with a flight attendant. Don't ask us, we don't know.
we're still in the engineering design, or the state is the engineering design phase for Corderville Road Bridge. Yeah.
Progress is happening on the Warren Barn.
Yes.
They've done.
Move to the fun stuff. Yeah, Arboretum, that's in great shape, and that's kind of it's growing, it'll start, going through its growing phases. Warren Barn, they've started, if they haven't started framing yet, they're gonna start framing quickly. They had to do some underpinnings on the silos
What kind of
and stuff.
foundation?
That's a concrete
Cement,
one, yeah.
concrete.
Yep.
Do they not have it doesn't look like it from the street, is the ice skating rink not gonna be up this year?
No, just because of the
I
construction.
thought because of the
Yeah.
construction.
Yeah, yeah. I had people ask about it. I'm like, yeah, no, with the construction, they can't do it.
Yeah, the dog park is moving along because, obviously they've stopped for the season, for winter. Beth, there were some really challenging aspects of that. It turned out to be a beach.
Instead of finding a lot of rock, they found a lot of sand.
Yeah, sand, like beach sand.
Like
it felt
something
like.
got put there or something at some point.
So Beth's done a really masterful job of kind of working that problem and making sure it's not too much of an impact.
Years ago.
Oh, really?
Well, where we live, it was all,
Oh,
it's
well,
all
yeah,
sand.
that's-
It was all
Oh,
sand,
yeah.
so it's not too far. I mean,
I didn't
True.
notice that.
Yeah, but Whittemore, it stopped at the base of Whittemore.
Well, you thought.
Well,
Yeah, but, yeah, so just a brief update on some of the bigger ones, just in the interest of time. I'll get this sheet updated at the end of January and get you a hard copy of it too.
thank you.
Great.
And that's the big, really big sheet.
I
Yeah.
know, we never really completed that, did we?
No,
Yeah.
we
Different
didn't do
thing,
our
different
press-
thing.
Different,
Oh,
different,
Yeah,
different thing.
yeah, this was the big sheet
huge
with
one.
everything
Yeah.
on
Okay.
it, so, with all the colors.
That
and-
other one's in abeyance right now because of
We all did.
everything else that's going on,
I just, when I saw it on the agenda,
right? Everybody's pressed for time. That's one less thing we have to deal with until we deal with a major issue. Okay. Just to remind everybody that February 4th, we have our open meeting law training from 6 to 7 p.m. And I believe it's going to be here, right?
Here and hybrid.
And hybrid, right? Okay. That'd be
So
great.
that's just before our meeting, right?
Yeah. Which is fine. Try to make it easy for everybody. And update on 40Bs, my friend.
Okay. So we'll start off with 10 to 60 Main. And that is anticipated to be closed out this coming Tuesday. Some draft conditions have been done. As we know, there's still some discussion around some of the decision, some of the conditions within the decision. And so those discussions will continue up until they can't. So that's the update on that. My understanding is that they also are anticipating filing with the Conservation Commission soon. So, they've got to go through that.
You just described the process. Then, once the ZBA finishes, and what's that all look like?
So once the ZBA closes, their hearing and issues a decision, or the hearing, I'm sorry, yeah, after the hearing's closed, they issued the decision. After a period, I believe it's 180 days of no appeal, or there's a certificate of no appeal, it's clear, to go. If there is an appeal, either by the applicant or by the town, although in this case that would be very, very difficult because it'd be the town issuing the decision, or a potential outside party, I don't know what that looks like exactly. Then obviously that process would run its course. If it needs to go to the HAC, that's an administrative procedure. If it goes through the court system, that would probably be done in Superior Court. Or Housing Court, I should say, or Land Court, I should say.
We know how the land court works because we're still waiting on the decision from February. No,
Yeah,
from February 25.
yeah, January or February. And then, so with the Conservation Commission, once that's filed, I believe, I'm gonna say it's 20 days they have to open the hearing. Once they get an application, and then, the Conservation Commission would be hearing the applicant in relation to the Wetlands Protection Act and not necessarily not the town's bylaw, conservation bylaw. So that's 10 to 60 Main Street. 61 has their decision from the ZBA, but they have filed with the Conservation Commission. The Conservation Commission and DEP have very serious concerns with their stormwater system and have asked them to go and redesign it. At 61 Waverly. So that is very,
Still tying to the town.
there's a significant concern about that. The culvert in Waverly Street, yeah, they have a significant concern about that, meaning DEP and the commission.
What's the concern?
That it's in a degraded condition, essentially, and you can't handle that.
So if it's in a degraded condition, then whose responsibility is it to bring it into condition?
The developer says it's the town's responsibility, that he's tying in. I'm sorry, you're gonna tie into something?
So who determines, who decides that? Who decides that, whose responsibility it is?
That's a good question. That's a good question. Mhm.
Yeah. Okay, well, we all know it's a good
I
question.
think we should ask it.
I mean, I think,
Well, maybe we need to ask somebody besides the developer.
but, I mean, at the end of the day, it doesn't meet the stormwater standards.
Yeah.
Right.
And
so
he won't
is
get
it-
a permit if he doesn't do that, so.
Right, he can't get a stormwater
So in that
permit.
way, it falls on him.
It falls on him.
Okay.
Whether or not he wants
Which is
it to
interesting.
fall on him or not.
Got it.
If
Got
he
it.
wants a permit, he probably needs to,
Got it. Thank you.
Oh, thank you for the clarification, Brandy.
and that's just my take, I don't really
I
know.
was gonna say, all right,
It-
we're gonna
it
quote you
sounds
on
like-
that, right?
It sounds like this is a question for town council and
Yeah, they're involved, yeah.
Okay, okay.
Yeah, they're,
And maybe we don't want to discuss it anymore right now?
No,
Maybe that's what I'm-
no,
No, I
no.
No, but
yeah,
it made
this
sense.
is good information here. And then 55 West Union is, also, there are some significant concerns from the Conservation Commission, from DPW, from DEP, related to that project as well. You know, one particular issue is the location of the sewer line. You know, they want to do a significant amount of work and put it pretty deep, so, and it just doesn't work out, so.
Doesn't work out on their property, but it works out on the street.
Yeah, and I don't know what the resistance is to that, but, yeah, there's something, but, there's a,
So there's
I'm
an
still waiting to
issue
get some
with the
specifics.
location of the sewer line in regards to their property, or just with the sewer line in general?
Well, it zigzags in their design, in their property, on their property, it would have to zigzag.
Yep, put your mic on, Joe, and talk into it.
Sorry about that, it zigzags on their property, where if they went straight out into the street and dig up that whole area, it's a straight line right into, but it's deep, like Michael was saying, it's deep.
Yeah.
And,
So by zigzagging, they can get around having to spend the money to make it deep. Is that it?
I don't think that's it.
Okay.
Just because.
So what's the motivation to zigzag instead of just going straight?
because of the,
I think it's ledge.
yeah, the ledge and the building itself, where they plan on putting it.
The other thing that is probably a little bit more complicated.
I'm simplifying.
Yeah, is of course a paper-related thing, which is that property and around that property has a number of easements from related entities on that, and I think you know, that's probably all I'll say about it right now. But
Okay.
just it's a complex web, and there's a lot of permissions that need to be had and all that stuff. So yeah, those are our 40B projects.
Thank you for the update, Michael. Next on the agenda is the consent agenda.
I move that we approve the consent agenda as presented.
Is there a second?
I'll second that.
All those in favor?
Aye.
Aye. That's
I
five.
also move that we go past 10 o'clock.
I don't want to move that.
We can get this
I'll
done,
second
too.
that.
We'll get to them real quick.
We got to vote it. So-
Yep.
Aye.
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 Thank you, but we can do it quick. Okay, budget update, sir, and next tri-board meeting.
So I think, well, I know Susan has sent around, some potential dates for our next tri-board meeting. And I think, we're zooming in or coming in on a couple.
It'd really good if we could do one before one of our meetings rather than.
I know.
Oh, really?
Yeah, that's what it looked like to me. I just voted, so.
Okay. Okay.
Yeah.
That's good.
Yeah, and I think, we want to have a substantive discussion on a couple of different aspects of the budgetary issue that we're talking about. And I think, number one, we need to figure out any kind of refinements that you want with option 3. After you've had some time to think about it, I might have some potential things to think about or some recommendations even. One thing I want to say is that I know that Jim is looking at this very methodically, in the sense that, he's not just approaching this as, okay, this is just how do we advocate for more money for the budget. He is really looking at this as, okay, how can I restructure the budget to make it more sustainable, moving forward with this.
That's a good thing,
infusion.
considering the
It
last
is.
2 years, the amount of one-time funds we used.
And I think, definitely, I think it's a good thing. It's something that needs to be done, and I think we're going to do the same thing, actually. Even though our budgetary situation is a little bit different, or it looks like it's going, in the way of option 3, not exactly the same path as the schools is. But I do think it is an opportunity for us, and I conveyed that to department heads today, that, we need to look at finding efficiencies and, doing what we can. We're always doing that, but we really need to kind of, in a way, zero base our budget again and start looking at that. I don't want to throw another financial term out there that's going to, oh my God, level funded, level service, zero based. Everybody's going to be having a hard time with that. But the other thing I want to mention is that we're going to look at having a budget meeting with those department heads like we usually do, and invite you and the FinCom, the school committee, to that. It might be a little bit different this year, in the sense that the total of the meeting might be a little longer. We're going to have people coming in basically by functional area, administration and finance, public safety, community center, just because there's going to be more level of question and answer at that stage than there is typically when we all meet. So that's that. And then the one thing I'm going to ask, or one things I have asked them to be prepared to talk about, is the implications, the service implications of a level funded budget. Like, what does that look like from a service level? Exactly. Like, this is what happens.
I'd like to rephrase that. Rather than what are we going to lose, what are we deciding not to do? I mean, yes, there's a loss for some of that, but I think it's what are we potentially deciding not to do? I think I think the public wants us to have a discussion that way, and not just what are we losing? Because we might decide, you know what, we want to do all of this. And that's what we then have to support and defend to the community.
The one concern I have about that, though, is that it may be unclear to people that if we decide not to do it, then existing services or whatever will be lost. It will go away. And so just from a communication standpoint, it's difficult, but like I do think that maybe saying that, like, maybe it's a combination of these things. If you say, like, if we decide to do this, then we're going to if we decide not to do this, then we're going to lose this.
Right.
That's
fine.
I think that's
but I can't
fine,
just,
but
yeah.
I think we just need to make it very clear that if we make decision X, then these are the consequences.
These are the impacts and consequences, yeah.
That's all
Agreed.
well and good for certain things in the community, right? I mean, you could say, all right now we plow your sidewalk. If we do this, we're not going to plow the sidewalks, right? It's harder to, I think, capture what it might mean in certain areas of government or in education, right? Right now we teach your kids this. Now we're going to only teach it this, or we're going to have.
Right now, we offer 15 sports, we're gonna offer 10 sports.
Well, we're already killing people with sports fees, so I mean.
But yeah, and that's why I think that the language of loss in this particular circumstance clearly communicates what is occurring. And so we shouldn't drop that. But I think a combination of that approach, saying like, if we decide to do this, then this is what we lose, or these, and here are the additional consequences or the impacts of that decision.
And
But
I
we
also-
have to be clear about it.
And I also think like one thing that would be helpful is as we go through this process to have things be quantifiable. Like, I think if it's one thing to say, okay, well, you know, we're gonna not be able to respond to as many calls from, you know, from our fire department. But what does that mean? And, you know, we've done X amount of calls in 2025. These are the amount of times that we needed mutual aid, or this is the amount of times that we've sent firefighters to another community and what that looks like. The average time that it takes for an ambulance to get to somebody's house is 3.2 minutes. And that could lengthen if we have to, you know, we're not gonna have as many people on a shift. What does that mean? And, you know, maybe that
Do we lose
means,
the opportunity to have another ambulance on the road to
Right.
cover up?
Right.
The material impacts.
and the thing of it is too, I think like, I mean, obviously we're kind of getting ahead of ourselves, but we've had the conversation about the capital budget and being able to do some of these things that are pretty much deferred maintenance, whether it's the turf fields or whether it's a roof on the schools or whatever it is. We have to also include that into the sort of this quantifiable thing, because if we don't have a roof on Pitaway, that means that kids cannot go to preschool there.
That's right.
What does that mean for the community?
The other thing I'd like to do is, I'd like to recommend is that any public meeting we have, we offer the time for citizens to either ask questions or give us their input.
I gotta second that.
So that the discussion, it's not just us and school committee and finance committee. And as part of our process, as our budget process and our planning process, we are building in public forums to talk about this and give, you know, so after the budget meeting that you have with your department heads, we plan something that says, okay, this is what was discussed and this is what we're looking at. Because I think it's important to have this discussion with the public.
Oh, absolutely. I think there's gonna be a point, I would say, like, at this tri-board meeting, once a decision is made, like, it's really getting, I would think, it's really getting handed off to us, to school committee and finance committee, to come up with a plan of how we're gonna execute this. And it's
Right.
going to be about the communication, it's gonna be about the public forums, it's going to have different
Get the message out.
components that we're driving. And time is gonna be like critical, like we just opened the warrant. Like it's January, if we do not have a decision for, like, let's hope we can get this done in 2 weeks and then basically hit the ground running for February 1st, we've got 3 months, and not even really truly like 3 whole months. We've got to be able to make that case by like mid-April. Like, people have to understand it. And
it's a two-step process, right? We have to have it pass the town meeting and it has to be on the ballot.
yeah.
When do we have to close the ballot?
Oh, I want to say 55 days before. Yeah, it just
So at our
Like-
next meeting, we're talking about when the election is and when the ballot has to be closed.
Yeah, I want to say March is usually when you date it. That's like the latest.
Right,
So you'd
Right.
want to have.
right, because papers become available as of February 1st.
Yeah, that's actually a good point. So.
Oh, the first week of February, I'm not sure.
I think it's typically the.
Yeah, I mean, it's interesting. I think just hearing, some of the conversation, I'll be honest, some of the lack of conversation really kind of, I mean, it's been a little quiet. And I was surprised. And I'll I think this is going to be an interesting discussion for the community to have. I would just caution you to just always check kind of like your motivations, especially when you're engaging the public and, you know, like coming in, like what are you trying to accomplish through that? I know, you know, transparency obviously is the ultimate aim here, and that's really, really important. And how does that relate to process? And, you know, are you sure that you're giving everybody an equal opportunity to say something?
Right, that's the
Or
thing.
are things like intimidation and fear running through the community and keeping
Right.
some voices from being heard, which does happen, and we know that happens. Everybody around this table knows that happens.
Well, that's why we have to, when we put the forums together, we need to make sure that we're building them with that in mind. But the whole point is to make sure that people have an opportunity to ask questions, voice their concerns, and get answers in a public forum.
Yeah,
So-
yeah. The public forum's great unless you feel scared to say something.
The other
That's a
thing
problem.
I'd like us to look at is
That's a problem.
our select board office hours in the next 6
Folks,
months.
I'm not sure if I'm being heard here. Your biggest concern is not the budget right now. It is the fact that you have some people who are scared to say anything because they're afraid they'll be targeted.
I think we have to provide many different avenues for people to provide feedback.
Right.
So public forum is definitely one of those avenues. As we're putting together, you know, when we're putting together our communications plan around this, I mean, there should be an email, there should be a this, there should be a that, but the public forum is also very important. And to your point, you know, things can happen in public forums, and I'm not saying that they won't, but I think if we structure it correctly and make sure that we do it respectfully, make sure that everybody that participates understands what the ground rules are, I don't think we have anything to fear. We don't have anything to fear. I think.
It's always
Michael, are
oriented.
you concerned that people will try to intimidate or
Harass.
influence or harass
People.
one way or the other?
I am concerned that if some people speak up and, you know, take certain positions, that they will be targeted online. I think they'll, or, you know, through social media or, you know, some other way, and made to feel like their voices don't count. That's what I'm concerned about. It happens, it's been happening.
It's been happening.
Yeah.
So I don't see anything different. We just have to be above that.
And the communications plan that you commissioned and signed on to last year actually says that you are responsible for ensuring a forum and community space that is safe
Right.
for everybody to speak.
So that's what we're going to do. I mean,
Okay.
you know, but I think it's important to voice these concerns because, you know, as we go forward and we structure these events, there's going to be a way that we structure them that's going to make sure that we can adhere to those values, and that's why we're doing it.
And I think we're gonna have to be prepared
Yeah.
to help people understand that we're gonna be hearing from both sides.
That's right.
Yeah.
And our goal as part of this will be to keep the conversation civil
Yeah.
and not let it get personal and not let language get used like we heard tonight. Right?
Right.
Yeah.
Talking
Right.
about the zealots against smoking.
Right. Right.
I think if we hear that language, we immediately have to say, rethink how you're saying this, please, because the conversation has to be kept civil. We're all in this community together, and people have a right to have their voice heard, but not in a way where you're attacking someone else.
Yeah.
Correct. We have to
that's great.
establish ground rules, rules of engagement.
Yeah.
All these things, that's what I meant by structure,
Yeah.
Yolanda, and that's Michael. You know, I think if we do that and do our pre-work, you know, we just don't go to a room and open a mic and let people speak into it. That's not
Right.
how that's going to be conducted. But if we structure it correctly, make sure that we're, you know, getting that feedback, recording that feedback, making sure that, again, that people feel safe, know that they can express their opinions, and people who don't, you know, they're gonna have to figure out a way to share their opinions in a different way.
Yeah.
because that's not the
Right.
forum
If
to do
not
that.
in a public.
If not in a public, I'm sorry, yeah.
Yeah.
But yeah, so, and we'll have to clearly communicate that before, during, and after.
It's the
Right.
preamble of the special, of a town meeting, when Adam reads
Yeah, pretty much.
his guidelines of how he wants his meeting to run.
That's right.
No different than that.
No different.
Absolutely
Maybe more
no different.
specificity around ground
Yeah.
rules, but
Yeah.
no different.
Then this will be a good discussion. This will be
I think so.
interesting.
I think it'll be very good. I mean, it's time for the community to have the discussion. It is.
There also has to be opportunities for people to submit, questions, ideas, thoughts.
Oh,
I mean,
yeah.
I think it can be as simple as a survey of some sort, or
Yeah.
a form that gets sent out in your
Yeah.
emails, and gives the people the opportunity to, anonymously
Yeah.
Give feedback.
give feedback.
Yeah.
But I think if, I would encourage folks to not be anonymous in their feedback if
Right.
they're doing it. If they're doing it in a non-public forum, I think it's important that people do give their names, because first off, if they have questions or concerns, we want to make sure that we can get back to them and address that specifically. And the other thing is that we don't want to have like a barrage of bots or a barrage of automated, people filling out forms or whatever, finding them online and stuffing the ballot box, as it were, with opinions that aren't real or,
No, I don't think
know.
if we don't, if we make it anonymous so that people, because some people won't respond if they have to provide an email, right?
But why?
It's the way they are.
Because maybe because they think that, we're gonna share it, or we're gonna do something, they don't trust us, whatever. I mean, ideally, yeah, I'm in favor of, okay, have people submit with email, but if they choose not to, we can certainly respond to those comments on a website.
Yeah,
You
I
know,
mean,
we've had this question and this is the response to it,
so I
so.
think people do need to understand, though, if they're going to submit it anonymously, that's how they're going to get their response. Like, we can't obviously go to them and address their
Yeah,
specific
no,
concern or
I
ask
agree,
follow-up
I
questions.
understand the limitations.
I think we might need to have a discussion about this, because my feeling is, I mean, anonymity has some benefit, but I want to make sure that the people who are responding are people who live in our community, who.
Just because somebody doesn't live here, though, and I understand why, yeah, it would be valuable to understand that we got 100 responses, and 50 and they were all from people that live in our community, and 50 of them raised this concern, and 40 of them had this. I mean, we wouldn't have that kind of data if we do it anonymously, right? Because we don't know who they are and why, what their motivation is or anything else.
Right.
But that doesn't say that there isn't something that can be learned from that, right? That somebody put something out there that is
Similar,
crazy.
again, similar to what happened tonight, right? When we were talking about the nicotine-free. Sure, it was great to hear from all the different people, but half of the people that spoke
Out of town.
were not Ashland
Right.
residents.
Right.
So I appreciate and I accept that information, but in regards to, for me personally, regards to making a decision for Ashland as a community, I give much more weight to people who live in our community who are going to be impacted by whatever decision we make.
Yeah, I certainly agree with you, but in terms of what somebody, it's interesting to hear perspectives. no matter what.
I agree, it's interesting to hear perspectives.
Especially when they've gone through it already.
Right.
The one thing I will say, and then maybe we talk about this
Yeah.
another time, is that I hear you both. I do lean towards folks identifying themselves so that we can actually, and that's really, in my opinion, more of almost like a customer service issue, right? Like, how are we going to address concerns if we don't know your concerns, if we don't know who you are? But, on the other hand, I do know that there are individuals here in town who do feel very intimidated with their interactions here with Town Hall and even with us. We want to make sure that we do hear all of these voices. So I think we've got to figure out a way to capture all of those different pockets and constituencies from within town and make sure people don't feel intimidated or feel like they can't participate because they're scared to whatever the forum happens to be.
The other thing also we got to think about is we also have to think about capacity. I'm hearing, because there's, in terms of being able to provide data and things like that. So, yeah, this will be interesting to navigate.
Yeah, well, we have to provide data. If people are asking something, we have to provide it. We have to find the capacity. We can't look like we've looked during the 40B hearing. and
Yeah.
ZBA.
I mean, we can, there are certain things that we know. The good news is that we can probably anticipate a lot of those questions and be ready with a whole bunch of stuff, so it's not like we'd be starting from zero.
Yeah, we're
right?
gonna need to
But
have sort
a
of
kit.
a basically.
Yeah, we need like kind of a baseline,
Yeah.
sort of FAQ and like data, you
I
know.
mean, a lot of it, you already are
information stuff.
putting together.
Right.
Yeah, I
And
think a
so is
lot of that
Jim
would have, yeah.
To even inform us, so.
Right, so if we could just kind of get like a base, that foundational level sort of information, and then people may have more specific drill down stuff from there, but.
Yeah,
That
I
we
mean,
can come ready. like-
I think we have to, you know, I'm listening to all the conversation around anonymity and things, and I think we can take questions from anybody. Like, it's not, you know, I don't need to know if John Smith at such and such email address asks a question, he can just ask a question. But if somebody is, I also don't want to necessarily give a mechanism for people to just throw hate out there
Yes,
either.
spam
So,
people and-
so, you know, we need to figure out that,
Yeah.
that mechanism for.
We do.
For, you know, just like when people come to our meetings, we like to know who they are. Because I think it is important to have the community be involved in this and not, you know, we're also probably going to hear about other communities going through this too. And so, you know, we're not gonna be the only ones that are talking about sort of the tough stuff. But I think the clearer that we can be about how our budget currently is being spent, like if we talk about how much is healthcare, how much is like the retirement benefits that we absolutely have to pay.
Yeah, we can do
How
that.
much of it is, you know, how much of it is negotiable? Like, how much do we really, I mean, like, those are the things, because
Mm-hmm.
people say, oh, well, you've got this huge budget, you can, you know, you have the money, and it's like, well, no, we really don't, like, really, you know.
Here's the breakdown.
Here's the breakdown.
Here's what it is.
Yeah.
Yeah, we can
You
do
know,
that.
So stuff like that, I
Yeah.
think, is really helpful, like, the context, for us to be able to
Precisely.
say.
Right. What are
like-
the employees that we have, what are they doing to provide services to the community?
It's just another way to look at it, you know,
Right.
another perspective. But I think, you know, and also just in line with that, moving on to item B, just an update on state aid. So they did have their consensus revenue hearing, the state did, I should say. And so they're looking at revenue projections for '27 to be, or tax collections at least, to be 1.7% to 3.1% more. So that does kind of fall in our projections. We use about 2% for state aid, the different state aid accounts.
Or a potential 2% increase over last year.
Correct. So
Minimum.
what the state is saying is, what they're projecting is between 1.7 and 3.1%. So 2% is going to fall in line with that if everything holds true.
So as we do our budgets, that's what we're gonna look at what we got last year for state aid, and we're gonna do a 2% increase.
Yeah, and that's what we've used so far.
Okay.
And so I'm just saying, so far, everything's tracking good on that. Where it's not tracking well is the health insurance, so we budget 8%, or we budgeted 8% in our projections. GIC is looking right now at about 11%, so we'll have to factor that in. And I'm letting you know this because I think what I'll do is I'll do one round of overall budget revisions at the end of January when the governor's budget comes out, and where we are with the GIC, and we'll lock that in, and that'll be our numbers going forward. And I'm hoping that if something fluctuates between now and the end of January, I've got some room on the revenue side or somewhere else to kind of make adjustments so we don't have to revisit, you know, the figures, the override figures and things like that. That would just be a mess. But yeah, so we'll do one more kind of round of revisions on that, and then we'll lock it in, and those will be the numbers that we have to stick with going forward through May. Okay, and yeah, And then the MMA conference is coming up in a couple weeks, and I think, some of you have registered. I was asked to do, by the MMA, kind of set up these regional, they're doing affinity groups, I believe, on Friday, where, different interests and different regions are.
On Friday or Thursday?
I think it was Friday. So MMA asked me to do the one for Metro West. So I would encourage you, if you're there, to come and I'll pull you in and get to meet some of your colleagues you might not have had a chance to meet. So pulling Catherine and Beth in. I recruited them too. So, but yeah, just wanted to let you know that.
Great.
Yeah, it'd be fun.
Just out of curiosity, who all is planning? You're going? I'm going to.
I haven't registered yet, but I'm planning on going.
I actually booked a hotel. I just did it personally. So if anyone wants to stay, I can make sure I have a 2-bedroom. Because I'm planning on going in Thursday and staying through till Saturday.
Oh, okay. Okay.
Doing the Friday night and dinner and stuff.
Okay.
All right, board reports. Been a while.
So I'm sorry I missed our dinner. I was sick at the beginning of December. I'm sick now in January, so I'm hoping it doesn't continue throughout the year. Coming up on January 15th, we have a Metro West Regional Collaborative meeting from 8 to 9:30, and then I'll be attending the MMA. Not really much else. Haven't been out doing much. I'm going to a garden club meeting this Saturday. And I am trying to set up a time to meet with Rob and Tony regarding the Upper Charles Trail. And I did have an interesting conversation from someone in Hopkinton regarding their trail, and they're going through some interesting stuff in Hopkinton right now. So if I hear anything more, I'll keep you updated. And that's it. Thanks.
Makita.
Everybody, really quickly, was well enough to partake in a lot of the holiday celebrations around town in Ashland last month. Just incredible to see the whole town come out for great events like Illuminate Ashland, and of course the downtown stroll and the cameo appearance by a certain Mr. Claus, et cetera, et cetera. It's always it's one of these times of year where I feel like our community really shines. So it was beautiful to be able to participate in those events and to see all the town folk come out. And I have to say that I saw some good Christmas shopping happen with local merchants, and I did quite a bit of my Christmas shopping locally as well. So that tradition will definitely continue. I did attend a historical commission meeting last month. They are in the process of redrawing their map for downtown historical district. There's going to be, I think, a gathering later this month around communications around that, which I intend to attend, and I can't remember the date off the top of my head. I apologize, because I, too, am not feeling very well. Yeah, and I'll leave it at that. Thanks.
Thank you. Yes, I too was able to attend some of our events in downtown, and the Illuminate Ashland was really special, and it is really nice to see the community come out like that. We were away on that previous weekend, but it was very special. I also, was really honored to be able to attend the employee recognition luncheon. Really, it's very special to see all the employees come together and to recognize them and have the opportunity to say thank you to them. Michael Fabry was, the Honorable Michael Fabry was the speaker and the guest speaker, and he's a very interesting gentleman, and it was great to hear from him. And there was one other thing that I need to write these down, but something else happened recently? No? All right, well, in any case, it's fine. So, all good.
It's jet lag. It's jet lag.
Jet lag, yeah, jet lag. Ooh.
Ms. Peretti.
Okay, I guess I'm up. So I will be at the Sustainability Committee tomorrow. I've reached out to all my committee people, ZBA, Conservation, and Sustainability. So everyone is embracing me with open arms. So actually, they're really actually very happy that we're doing this initiative to be better connected. So thank you to you guys for the work that you put into all this. I will have more to report at our next meeting. I did want to just give a quick shout out. I know it was on our consent agenda today, but we didn't really talk about it, obviously. But we were able to release over $4,000 from our the select board account that we had created, the gift account, to the Ashland Day Committee, which I think is awesome that we were able to raise enough money to be able to put on Ashland Day and also kickstart this upcoming year. I did want to give a huge shout out to Diane Mortensen and Cindy Sincata and Stephanie Pemberton, who just came through just like gangbusters for us, because it was a very compressed time schedule, a lot of moving parts, and it seemed like every time we turned around, we had a different crisis. So they were fantastic to work with, and just thank you to them for all their help. So
Are the two Ashland Day committees working together to move forward, or?
Yeah, we haven't met yet, but because of the holidays and stuff, but
we'll connect.
We'll get
So,
it.
yeah. So, but we have people that are looking forward to being a part of it and getting the
Same here.
40th year of Ashland Day up and going. And then the only other thing I just wanted to say, we were talking about Illuminate Ashland, and that was my first Illuminate Ashland this past year. I know Chrissy Reynolds generally does it every other year, so it's not an every year thing. But that was my first Illuminate Ashland, and I just wanted to.
She does it,
It's amazing.
It was amazing, thank you. I just want to add, I actually started over at Anne Marie's, Chrissy's dance studio, and it was so amazing to just watch the performers, and mostly young students, and they were just remarkable. And I found myself, I walked out of the room and I was grinning from ear to ear.
Oh, yeah.
It was just so engaging and really special, the way it was lit. Everything was really done.
It was
in a
intimate.
very-
It had that
was very
intimate
intimate. It
feeling,
really
yeah.
was very well done. So, and she's really a huge asset to the community.
And I think that's it for me.
That's it.
Yeah.
Thank you. Okay, real quickly, I had the opportunity to sit in this room a couple of weeks ago when the Affordable Housing Trust sat in on the lottery at 487 Main Street. There were 4 names. Actually, there were 4 numbers. They don't give names. Everything's done, without knowledge of who that person is going to be. The numbers were picked. There were four applications that met the criteria. There was 30 of them altogether, but they had to eliminate some of them because the criteria was not met properly. And so they were filtered out. So after the filtering out of all those, there was 4 that met the criteria, and the selection was made, and we'll hopefully hear next week as to who the individuals are once they get there. So I'm keeping my fingers crossed that hopefully it's
This
someone
is for
local.
the Habitat for
For the
Humanity
Habitat for
house that's
Humanity,
being
yeah.
built.
Yeah,
And they'll then have to jump in and start helping out.
absolutely, yeah.
Great.
Which was totally awesome. The other thing was, Ashland does a great job with the holiday festivities. It's just incredible to see the faces. I can tell you that, when you drive that, when you do the Santa ride around town, oh my word. I have to tell you, the faces of not just the kids, I'm talking parents that are out there. They love it. They were in their jams. Now, it was cold. I don't know. It was cold. But, oh, my goodness, it was a hoot and a half. And so thank you to all the folks that came out and waved. And was a lot of fun. It was,
And there were fire trucks, and there were
And there were-
police cars. It was,
they were, oh my word.
it was like a
sight
little
to see.
parade. It really was.
I mean,
yeah.
and I may have,
Yeah.
if interested, full disclosure, been one of those parents in their pajamas that possibly.
I didn't want to.
But isn't it, like,
It's very exciting.
I get excited, 'cause especially when it snows and you've got like the lights around the poles.
Oh, yeah, it was very
Dust
festive.
balls
Yeah,
everywhere,
Yeah.
and it's like,
it was very, very festive.
yeah, and Jordan did a lot of great work, and Beth obviously kind of masterminds the whole
Yep.
thing.
No, it was awesome. Just to go downtown, it looked, like a Thomas Kincaid Christmas card.
Yeah.
It was very, very nice.
Stars all up.
Stars all up. Yeah. The menorah lighting was phenomenal. Everything went well. I missed the appreciation dinner. I got there late, but it was nice that I went around the tables and thanked everybody for all the hard work they do year round. And we should do it more often.
Yeah, it was great to have
Yeah.
you both there.
And
But
Joe,
it
the
was-
other thing that you and I did, we met with the gentleman from the Donnelly property,
Oh, yes.
who was
They
turning
signed the deed
over,
over.
signing the
The
deed over
donation.
to the town.
Yep,
And we
Yep.
came down and
And
met
he was-
him and thanked him, and
yep. He was,
stuff
a lot of good stuff happened, a lot of
It
people.
was,
and
it
that-
was
and
a
all
busy
that-
year, but it was a good year,
It was
2025.
a very, I thought it was a successful year, very busy year, like you said, and there's still a lot more to get done. And
Yep.
so let's do it.
It's nice, though, to start seeing the sort of end of some of the projects.
Oh, my goodness, yeah.
126.
Oh, my goodness, yes.
Downtown.
I can't
things like
remember,
that.
what was it, 3-4 years ago? We were all, well, we were a lot younger, too. We're going.
We have a
yeah.
lot more hair, Joe.
Well, yeah, that's, remains to be seen. But with that, welcome back, everyone. And at this time, I'll be happy to entertain a motion to adjourn.
So moved.
Second.
All those in favor? Aye. And we'll see you on the
Happy New Year.
21st. Thank you and good night. Drive
Good night.
carefully, it's very icy out there.